ನನಗೆ ಗೊತ್ತಿಲ್ಲ ಆಯಕ್ಕ ಅವ್ರ ಫೋನಲ್ಲಿ ಹೆಂಗ್ ಬರುತ್ತೆ.
Good morning, all. Can you hear me? Can you hear me? Yeah, good morning, all. I'll start, Ranjan. Ranjan. Good morning, all. So today we have organizing the International Pathology Day, and the Department of Pathology from Devaraja's Medical College, Sri Devaraja's Academy of Higher Education and Research. On this occasion, I welcome the founder chairman of Shri Devaraja's Education RS Education Trust, Shri R.L. Jalapaji, and Department of Pathology from Devaraja's Medical College, Shri Devaraja's Academy of Higher Education, and Shri Rajesh N. Jagdale, Vice Chairman, SDET. I welcome the founder chairman of Shri Devaraja's Education RS Education Trust, Shri R.L. Jalapaji.
This one. Reading more. Yeah, reading more. Slide support full one. Reading more. Oh, no. Which one? Minimize myself. This is a pocket.
Is it okay?
Wait, Shilpa, what are you saying? One screen? You're saying one screen or two screen? You're saying inside.
Start ಮಾಡಿದ್ದಾರೆ ರಂಜನ್.
ಗೊತ್ತಿಲ್ಲ ಅದು ಗೊತ್ತಿಲ್ಲ.
It's okay. I'll start then. ಅದು ಚಾಟ್ ಬಾಕ್ಸ್ ಬೇಡವಾ ರಂಜನ್? ಚಾಟ್ ಬಾಕ್ಸ್ I'll start.
Chat box ಇರುತ್ತೆ.
Yeah, good morning all. Today we are organizing International Pathology Day from Department of Pathology, Shri Devaraja's Medical College, Shri Devaraja's Academy of Higher Education and Research. On this occasion, I welcome our founder chairman, Shri R.L. Jalapaji, and vice chairman, SDET, Shri Rajesh N. Jagdale. Secretary SDET Shri G.H. Nagaraja, Administration and Finance Shri Rajendra J. I also welcome our Honorable Chancellor Dr. S. Kumar, Dr. A.V.M. Kuti, Pro Chancellor, and Dr. C.K. Ranjan, Pro Chancellor, then Dr. Honorable Vice Chancellor Dr. Pradeep Kumar Ji, Registrar Dr. K.N.V. Prasad, Principal and Dean, Faculty of Medicine, Dr. Sriramlu PN, Vice Principal, Devaraja's Medical College, Dr. Shashidhar KN, and Medical Superintendent RLJH and RC, that is Dr. SM Hazim Moyuddin. I also welcome all the audience, and the focused audience of the today's program is the school children. Welcome all students. And today's theme for the International Pathology Day is the Cancer Awareness Program, what we have planned for the school children to bring the awareness of regarding the cancer, and also to know some of the risk factors which is responsible for the cancer, by which the cancer, some of the cancers are preventable. So you should have the knowledge of the regarding the cancers. So before going at this time, I take the opportunity to introduce you. I mean, for the school children especially, the role of the pathology and the pathologist in the patient care. So who is pathology? See, we have the various diseases in the body wherein the disease can present as an ulcer or as a nodule or as a lump, or in Kannada I can say gaddegal tara barutte. So all this, these lesions are excised. Adu dehadinda tegitare, tegidbiಟ್ಟು they give it to the laboratory for the examination. So when it reaches the laboratory, it is the pathologist who take over the turn, and this is how we receive the this is the tumor wherein the skin is there, and this is how the pathologist will examine. And this tissue, we call it as biopsy, and the examination we call it as histopathology examination. So the pathologist will cut like this, make the slices, and then a small bits of this representative bits will be taken and the tissue will be processed by various chemical solutions, and ultimately the thin sections of the tissues will be taken with the help of the paraffin wax, which will be placed on the slides. Then these slides, it will be stained with the stain usually routinely used is the hematoxylin and eosin stain, and this slides will be placed on the microscope and it appears like this. So looking at this, depending upon various patterns of the tissue, we give out the diagnosis. So whether it is the infection or whether it is tumor or whether it is cancer, ಅಥವಾ ಮಾಮೂಲಿ ಗಡ್ಡೆ ಈ ಥರ ಏನಾದರೂ ಇದ್ರೆ ಲೈಕ್ we give out the diagnosis. In addition to biopsy, pathologists also do the other test like what we call it as the fine needle aspiration. In common language it is called as ಸೂಜಿ ಪರೀಕ್ಷೆ. ನೀವು ಕೇಳಿರ್ಬೇಕು ಸೂಜಿ ಪರೀಕ್ಷೆ ಅಂತ. ಈ ಸೂಜಿ ಪರೀಕ್ಷೆ ಯೂಶಲಿ ಗಡ್ಡೆಗಳಿಗೆ ಮಾಡ್ತಾರೆ. So the common test it is done is in breast cancers. Breast cancer usually present as mass in the breast. So this is how we take the material, we place it on the slide, and again we stain it and we bring it under the microscope like this. And this is how the cells appear. So this is the normal cells. For example, I have taken the breast cancer. So the normal cells of the breast cells appear like this. The cancer cell appear like this. So this is the difference between the two cells. In addition, in the pathology lab, we also receive some of the samples like blood, urine, and body fluids and stools. All these samples we receive in our department, where the pathologist will interpret the samples and give out the diagnosis. And diagnosis is very much required for specific treatment. Correct diagnosis adre correct treatment sigutte patient ge. So this is the role of the pathologist. And with this background, today we are celebrating the International Pathology Day. It was first put forth by the Royal College of Pathologists, London. It was started in the year 2014. It is mainly to recognize and celebrate the contribution and achievements of the pathologist in the pathology lab and the laboratory medicine, and also to improve further the outcome of the health outcome by the contribution of the pathologist in the global patient care. So without pathology, there is no medicine, because as I already told you, pathology gives us specific diagnosis so that the patient will get a specific treatment, correct diagnosis with correct treatment. Okay. And all cancers are diagnosed by pathology. So today's theme of the celebration is the cancer awareness program, and the diagnosis of the cancer is always given out by the pathologist. So what is cancer? You might have heard by this time, I think all of you are in the class 9 or 10. So cancer means the good cells which behave properly will become abnormal, will become bad cells. They not only become bad, they grow in an abnormal pattern. And after the growth, it spreads to the adjacent organs. And sometimes all the organs of the body, it can spread to almost all the organs of the body. So the burden of cancer worldwide, the breast cancer is commonest. These are the order of the cancers. The breast cancer takes the rank number 1, and following the prostate cancer. This is the worldwide statistics. And in India, if you take in 2008, this is the statistics wherein the cervical cancer is the first one, followed by the breast cancer, and then comes the ovarian, and that is the lip stomach cancer, that's the GI cancer, and the colon cancer. So this is the order. And if you move on to the 2018 statistics, this is the 2018 statistics of India. The breast cancer has taken over. It has taken the first rank, followed by the oral cancer, cervical cancer, like this. And also, in the men, the burden of the cancer differs between the gender, that is male and female. So in men, oral cancer, lung cancer, stomach, colorectal cancer, and esophageal cancer. These are the various organs in the body. I think by this time you might have read. So these are the common cancers in men. Whereas in females, the breast cancer, cervical cancer, ovarian, and the oral and the colorectal cancers are common. And it has been stated that cervical, gallbladder, oral, and pharynx cancers are more, that is, it forms the highest rate worldwide. And this slide shows you the common causes in general for all the cancers, which you're supposed to know, because some of the cancers are preventable also. Some of the cancers. See, 25% of the risk of the cancer, I mean, the causes of the cancer is not known for any cancer. But some of the causes which has been proposed, see, for example, 10% of the cancers are because of the lack of personal hygiene. So this you can rectify, this you can prevent. And 40% are because of the tobacco and the pan masala. And diet and poor preservation of the food also constitute 6%. And 4% constitute genetic, that is, it runs in families. You might have heard, that is, the breast cancers and the ovarian cancers, it runs in families. So probably that is the one of the risk is the 4% is the genetic factors. And also obesity. For the breast cancer, obesity is one of the risks for the breast cancer. And these are the common presentation complaints of the patient, how the patient will have, that is the present to the doctor. So sore throat, and also that is bleeding or the discharge from the orifices of the body. Weight loss, loss of appetite. Appetite means the patient doesn't feel like eating, and difficulty in swallowing. And lumps means ಗಡ್ಡೆಗಳು, ದೇಹದಲ್ಲಿ ಎಲ್ಲಾದ್ರೂ ಗಡ್ಡೆಗಳು ಇರ್ಬೋದು. ಆಮೇಲೆ then cough, persistent cough. And also change in the bowel habits. Bowel habits andre patient may have continuous diarrhea in spite of taking antibiotics, or constipation. So these are some of the complaints patient may present with doctors. And with this, the government of India has taken some measures, that is, and government of India has marked some of the months as the cancer awareness months. For example, cervical cancer in month of January. And also, see, for example, the breast cancer awareness, that is October is marked as the month for the awareness of the breast cancer. So, and colorectal cancer, this is for the month of March. So this is how the different months are marked for the awareness of the various cancers. So with this, I've given a broad introduction about the cancer, and as per the protocol, which I have shared with you, the brochure will go as per the brochure. So I'll take up the first one, that is the cervical cancer. So what is the cervix? Cervix andre eno? This is the commonest cancer in females, especially in developing countries, and particularly in India, especially for the rural women. Okay. Because of lack of, that is illiteracy also plays a role, and also lack of awareness. And this is the cervix. See, you might have read in your classes, that is, this is the uterus, this is the ovary, and this is the lower part of the uterus is called as cervix. In Kannada, what I can say is that is Garbhachilada Tottu. So that is the cancer. This is where the cancer happens. This is the one. And see, this is how the cancer starts in the cervix. So once it starts, the cancer, it doesn't keep quiet. Slowly it spreads. It spreads on both the sides. It can spread downwards. This is the part what we call it as vagina. And also it spreads upwards towards the uterus proper. And later it can spread laterally, and also spread to the various organs of the body. So what is the burden of cancer? I told you it is the commonest cancer, especially in developing countries, especially in India. So worldwide, see, annually, ಒಂದು ವರ್ಷಕ್ಕೆ 5,27,000 cancers are reported. That is as per the 2012 statistics. And also worldwide, they have noted that it is the 4th common female cancer. And it is the 2nd most female cancer between 15 to 44 years. And if you take the mortality andre it is the death rate because of this cancer, cervical cancer. Okay, so annually ವರ್ಷಕ್ಕೆ 2,65,000 ಸಾವಾಗುತ್ತೆ ಈ ಕ್ಯಾನ್ಸರ್ ಇಂದ. Then approximately 728 women die every day, and 30 women die every hour. It means what? For every 2 minutes, ಪ್ರತಿ 2 ನಿಮಿಷಕ್ಕೂ ಒಂದು ಮಹಿಳೆ, I mean, ಡೆತ್ ಆಗುತ್ತೆ ಈ ಕ್ಯಾನ್ಸರ್ ಇಂದ. It is the worldwide statistics. If you take the India, like it is 72,000 deaths annually, varshake. Then 200 women die every day, 8 women die every hour. It means what? For every 7 minutes, 1 woman dies in India because of cervical cancer. So this is the burden. And if you compare the worldwide statistics with India, see here, almost 25% of the cases is contributed by India, both in terms of incidence and both in terms of mortality. Mortality andre savu, that is death because of this cancer. So this is the burden of cervical cancer. And in general, risk factors, I told you, for any cancer, there is no definite cause. We put it as risk factors, which are sometimes preventable. So low socioeconomic status, nutrition deficiency, genetic factors, and multiple sexual partners, poor personal hygiene. This is very important in case of cervical cancer. Hygiene plays a very important role, and unusual use of oral contraceptives, tobacco usage. So all these are some of the risk factors, and of which one virus has been proved to contribute for the risk of this cancer, that is human papilloma virus. And especially when the patient is also having HIV infection, so the rate of the cancer is quite high. And what is this HPV? That is human papilloma virus. It spreads through sexual activity. This human papilloma virus, once it spreads and reaches the cervix, it causes abnormal growth of the cells, and by which abnormal growth gives rise to cervical cancer. So this is the concept of HPV test. So idan taleli itkondu HPV test anta ಮಾಡ್ತಾರೆ. I'll come to that later. So what are the symptoms the patient can present? That is unusual vaginal discharge. It can be white discharge, or it can be bleeding per vagina, or it can be menstrual cycles will be longer, long duration of, that is menstrual cycle, heavy flow and discomfort while urinating, and also the leg pain. So these are some of the symptoms. Symptoms antandre how the patient presents, that is complaints of the patient. So how do you diagnose? See, for the diagnosis of this cancer, once the patient comes to the doctor, physical examination, history taking irutte, then pelvic examination, Pap test, HPV test, endocervical curettage, colposcopy, and biopsy. Of this, you keep three things in your mind. One is Pap test. The other one is the HPV test anta ಹೇಳ್ತೀವಿ. ಇನ್ನೊಂದು biopsy. ಇವೆರಡು screening test. And this is the confirmative test. Means the patient is really, that is suffering from cervical cancer. And in spite of the availability of all this test and the screening test, which are, the programs are quite streamlined in Western countries. Western countries, especially in UK and US, the screening tests are very much streamlined, by which there is a lot of control of the cervical cancer, which is not happening in India. And so by which, 90% of the women die of cervical cancer because of the poor access of the prevention, screening, and treatment. Especially the rural women suffer a lot, and rural women are not aware that screening tests are there, and also the biopsy which can be done, mainly because of the socio-economic status, and also the shyness the woman has to present herself to the doctor with a complaint. I told you you remember three things. One is the Pap test and the HPV test. These are the screening test. So ಯಾವಾಗ ಮಾಡಿಸಬೇಕು ಇದು Pap test? So under 21 of year age, it's no need of that patient undergoing this test. The screening test can start at the age of 21 years. 21 to 30 years Pap test ಮಾಡಿಸಿದ್ರೆ 3 ವರ್ಷಕ್ಕೆ ಒಂದ್ಸಲಿ ಮಾಡಿಸಬೇಕು. ಆಮೇಲೆ between 30 to 65 years Pap test ಅಷ್ಟೇ ಮಾಡಿಸಿದ್ರೆ 3 ವರ್ಷಕ್ಕೆ ಒಂದ್ಸಲಿ. Pap test with HPV test ಮಾಡಿಸಿದ್ರೆ 5 ವರ್ಷಕ್ಕೆ ಒಂದ್ಸಲಿ. These are the screening test. And above 65 years, there is no need of the woman undergoing this test, provided the previous test of us. ಅಂದ್ರೆ ಮುಂಚೆ ಏನಾದರೂ ಟೆಸ್ಟ್ ಮಾಡಿಸಿದ್ರೆ ಅದು ನೆಗೆಟಿವ್ ಬಂದಿದ್ರೆ 65 ವರ್ಷದ ಮೇಲ್ಪಟ್ಟವ್ರಿಗೆ ಇದು ಬೇಕಾಗಿಲ್ಲ. ಇದು ಪ್ಯಾಪ್ ಟೆಸ್ಟ್ ಅಂದ್ರೆ ಏನು ಅಂದ್ರೆ ಇದೇನ್ ಮಾಡ್ತಾರೆ, ದ ಸರ್ವಿಕ್ಸ್ ಇಂದ ದೇ ಸ್ಕ್ರೇಪ್ ದ ಸೆಲ್ಸ್ ಆಫ್ ದ ಸರ್ವಿಕ್ಸ್ ಅಂಡ್ ದೇ ಪುಟ್ ಇಟ್ ಆನ್ ದ ಗ್ಲಾಸ್ ಲೈಟ್. ಸೊ ಇದು ನೋಡಿ, ಇದು ನಾರ್ಮಲ್ ಸೆಲ್ಸ್ ಅಂಡ್ ದಿಸ್ ಇಸ್ ಅಬ್ನಾರ್ಮಲ್ ಸೆಲ್ಸ್. This is the normal cells. So these are the abnormal cells. So once it is abnormal cells are seen, it means Pap test is positive. So Pap test positive ಬಂದಾಗ ಏನಾಗುತ್ತೆ, patient may be probably suffering from cervical cancer. ಅವಾಗ biopsy ಮಾಡಿಬಿಟ್ಟು ಕನ್ಫರ್ಮ್ ಮಾಡ್ಕೋಬೇಕು, ಆಯ್ತಾ? And HPV testing. ನಾ HPV ಅಂದ್ರೆ ಏನು ಹೇಳಿದ್ದೀನಿ, human papilloma virus, and I told it causes abnormal cells in the cervix. Because of the infection of this virus, it causes proliferation of the abnormal cells. And then again, the sample is taken from the cervix only here. And with that, the HPV testing is done. So once the patient is diagnosed with cervical cancer, the treatment aspect, I'm telling you the basic thing because you're still school children. Any cancer, we stage it into stage 1, 2, 3, and 4. And similarly in cervix, stage 1 and 2A. So 1 and 2, that is early cancers are usually treated by hysterectomy ಅಂತ ಹೇಳ್ತೀವಿ, ಅಂದ್ರೆ ಸರ್ಜರಿ. And stage 3 and 4 advanced cancer, you be treat by the radiotherapy and chemotherapy. Chemotherapy ಅಂದ್ರೆ ಮಾತ್ರೆಗಳು ಔಷಧಿಯಿಂದ, ರೇಡಿಯೋಥೆರಪಿ ಅಂದ್ರೆ ಕರೆಂಟ್ ಥೆರಪಿ. ಸೊ ಸ್ಟೇಜ್ 3 and 4 ಕರೆಂಟ್ ಥೆರಪಿ ಮತ್ತೆ ಇದು ಮಾತ್ರೆಯಿಂದ ಮತ್ತೆ ಔಷಧಿಯಿಂದ ಟ್ರೀಟ್ಮೆಂಟ್ ಆಗುತ್ತೆ. ವ್ಯಾಕ್ಸಿನ್. So the main focus of this program is That is, you should know the awareness of the cancer, you should know the risk factors, and prevention is the main focus of this program. So there is a chances of prevention from the women suffering from this cancer. That is that recently the HPV vaccine has come, and this HPV vaccine what ಯಾವ ವರ್ಷದಲ್ಲಿ ಕೊಡಬೇಕು ಮಹಿಳೆಗೆ 9 to 45 years of age group. So how many doses? ಎಷ್ಟು ಡೋಸ್ ಇರುತ್ತೆ? 3 doses ಇರುತ್ತೆ that is in a duration of 6 months. That is 0 dose 2 months and at the end of 6 months. And in the market, you know, it is available as Gardasil and the Cervarix. And HPV vaccine, HPV virus, there are 100 types, of which 14 to 15 types are, that is high risk ಅಂತ ಹೇಳ್ತೀವಿ, ಅದರಿಂದನೇ ಕ್ಯಾನ್ಸರ್ ಆಗೋದು, ಸರ್ವೈಕಲ್ ಕ್ಯಾನ್ಸರ್. ಅದರಲ್ಲಿ number 16 and 18 are commonest, which are common in India also to cause the cervical cancer. And Gardasil, you know, recently one new vaccine has come which covers, that is 9 types of HPV vaccine, and which protects 99.8% of cervical cancer in women. And in market, you know, the vaccine is available in these trade names: Cervarix, Gardasil, and Gardasil 9. Cervarix ಅಲ್ಲಿ ಎರಡೇ ತರ vaccine, protection against only 2 types of HPV, type 16 and 18. Whereas Gardasil, you know, 4 types, 16, 18, and 6 and 11. Whereas Gardasil 9, it protects against 9 types of HPV vaccine. So it gives more protection. And again, all these vaccines can be given between 19 to 25 years in females. So it means cervical cancer is a preventable cancer. So the vision of the World Health Organization, that is to decrease the cervical cancer for less than 4 cases per 1 lakh women, that is annually. And they have kept some target, that is World Health Organization, that is by 2030, the target is 90% of the girls should be vaccinated, that is by age of 15 years. And 70% of the women should be screened. They should undergo screening test either by the pap test or the HPV test between 35 to 45 years. And 90% of the women who are detected with early cancer either by the pap test or by the biopsy, they should be able to reach the facilities of the treatment. So this is the target for the World Health Organization, which has to be met by 2030, that is year. So with this, I conclude my talk regarding the cervical cancer. If any questions are there, I can attend for at least, that is the minimum of 3 questions. ಶಿಲ್ಪ, ಏನಾದರೂ ಡೌಟ್ ಇದೆಯಾ? ಏನಾದರೂ ಕ್ಲಾರಿಫಿಕೇಶನ್ಸ್ ಬೇಕಾ? So with this, the next talk is from Dr. M.L. Harendra Kumar. Sir is a senior professor in Department of Pathology in our college. Sir will be talking about gastrointestinal tract cancers, focusing on the stomach cancer. This is again one of the top cancers in the Society of India. Change.
ಫುಲ್ ಸ್ಕ್ರೀನ್ ಆಗ್ತಾ ಇಲ್ಲ. ಶೇರ್ ಆಗಿ
ಈಗ ಆನ್ ಮಾಡಿದೆ.
Hello, good morning everybody. So I will be giving information on gastric cancer as a part of this cancer awareness program. So what is a cancer? Everybody call it as a generic term used, but medically we call it as neoplasia. Neo means new, plasia means growth, neoplasia. Why we call it as a cancer? Because this word derived from the Latin word crab. So like crab, anything comes across that it catches, no? Like that, the cancer start growing in any part of the body. It starts adherent and it starts growing. So the study of tumor is called as oncology. So as you know, the cancer, it is an uncontrolled growth and spread of normal cells within the body. The normal cells, it differs from the cancer cells. The cancer cells, they lose control over growth and multiplication when they start growing in the body. They don't self-destruct when they become worn out or damaged. That means when the cell become old, it's supposed to destroy, but here the cancer cells continues to grow and it crowd out healthy cells. So it grows more than the healthy cells. That's why it forms a mass in the body that we call it as a new growth or a cancer. The cancer arising from the stomach, you know the stomach, parts of the stomach, it's a J-shaped. It has different parts of the body of the stomach, fundus, body, and the pyloricum. And the function also you know, because it is the one which keeps whatever you eat as a storehouse, acts as a reservoir, and it helps in digestion of food and reduces the size of the food whatever you have taken, and it also helps to absorption of vitamins which are required for our the body. Why the gastric cancer occurs? Because it is one of the fifth most malignant tumor and third leading cause of cancer related deaths. There are areas where there are high risk areas in the world, for example, China, Japan, Europe, South America, where the gastric tumors are more common. Low risk areas are like South Asia, North America, New Zealand, Australia. So this November, it is a stomach cancer awareness month. As you know already, various months are celebrated. This November is called as stomach cancer awareness month. So what causes gastric cancer? Three more important, because it is any cancer or a multifactorial. More than one factor causes. One is the lifestyle, another is the environment, and the family history. Lifestyle risk factors. If persons are smoking, if they are taking diet, high fat, low in fruits, vegetables, lack of exercise, obesity, all are lifetime style risk factor responsible for developing the cancer. Environmental risks. If you are exposed to the air pollution, industrial pollution, chemical exposure, or other smokes, so can give rise to a cancer. Inherited case, genetic. So less than 15% of cancers are inherited. That is a transmission from the parent to children. Most commonly, inherited gene occurs as a result of there is a inherited gene mutations. So like colon cancer, breast cancer, ovarian, if the parents have got, the siblings or the children may get the cancer. So usually the stomach cancer usually not occur before the age of 40 years, but it's twice as frequent in man than woman. So more common in man than one of the leading cause of death from the cancer bodies is gastric cancer also. And I already told the highest incidence is seen in Japan and South America. And the worldwide rate is 15.6 per 1 lakh people. That is the incident. So the recognition of risk factors, what are the causes of this? and application of strategies towards their elimination. So you have to remove all these risk factors. They are the paramount importance for this awareness program. So gastric cancer occur as a result of development of what is called as chronic atrophic gastritis. It is usually occur in patients who are already told risk factors, tobacco use, then there will be infection caused by H. pylori bacteria, and the diets with high levels of nitrites, nitrates, salt, smoked food. So these are the some of the causes for helps in development of the gastric cancer. Smoking, of course, one of the leading cause for that any cancer, increase the risk of gastric cancer by 50 to 60%. So it is estimated that smoking tobacco is responsible for 11% of all stomach cancers worldwide. So that is the danger of the smoking. And this uses, it decreases the levels of carotenoids and vitamin C, which acts as a protective agents against this disease. Prevention, the tobacco use is associated with the H. pylori infection, which in turn leads to atrophic gastritis. So this is also again, infection is associated with 2 to 6-fold increase in the risk of developing gastric cancer. If any person develop this infection by H. pylori, more chances of getting gastric cancer. In addition to the other factors, like people so frequently take coffee, colas, spicy food, caffeines, all are can acts as a risk factors for developing a stomach cancer or GIT tumors. So alcohol intake, again, another cause, it disrupts the mucosa with secretion and it causes mucosal damage. So the normal gastric mucosa usually will be there disturbed by H. pylori infection or other cause factors, various other risk factors. Develop a infection first, then it goes for atrophic, then there will be other changes occurs. Ultimately, the stomach cancer develops. So, as I already told, the risk factors, the smoking, H. pylori infection, family history, poor diet, obesity, long-term inflammation, all are acts as a stomach cancer. So, if the person develop a stomach cancer, he start developing some symptoms. So, he start complaining, pain in the stomach area, difficulty in swallowing, weight loss, bloated abdomen. So, he tells a distension of the abdomen, vomiting, sometimes he vomits blood also, and sometimes passing the blood in the stool. So all these the signs and symptoms of the gastric cancers. So to detect the cancer, you have to do various investigations, blood investigations you have to do, endoscopic examination, ultrasound, CT scan, and laparoscopic also should be done. So endoscopy is the gold standard because we take a biopsy from the ulcer or from the tumor. So this is how we use the upper endoscopy. So here a thin light tube is inserted through the mouth to look for abnormal areas in the esophagus or in the stomach and part of the intestine. So then during that time, we will take the tissue biopsy and that will be studied by pathologist to diagnose the tumor is there or not. And also we do another test called barium swallow. Here the patient swallows a barium liquid. It is a silver white metallic compound. So it flows through the esophagus and into the stomach. Then series of X-ray will be taken and we'll find the abnormal filling areas. So this is how the stomach, the tumor starts growing. You can see in the location in the body of the stomach. And we will take X-ray also to rule out the stomach tumor. This is another picture showing the tumor growth within the stomach. So is another specimen here. It is become, the stomach is become leather bottle type because of the increased thickness. So preventive measures. So as already told, you have to increase the physical activity, avoid obesity, eat healthy practice, reduce occupational environmental exposures, reduce alcohol, and immunization against hepatitis B. So cancer rates could decline by about 20% if everyone consumed at least 5 fruits and vegetables a day. So because cancer fights substances are present like antioxidants, dietary fiber, carotenoids, flavonoids, all are present in the fruits and vegetables. So eat always healthy food. Limit alcohol, so should not drink alcohol. Avoid alcohol drinking and use of unnecessary drugs. Avoid smoking. This is the one of the major risk factor for any cancer. So is the leading cause for preventable death. So it is the second most cause for any cancer in the body. So screen test, why it is especially important. Screening test can be done to rule out the various cancers. It may be colon, breast, or any other organs, because the treatment of cancer is most successful when the cancer is detected as early as possible, even before the symptoms occurs. So the conclusions: you avoid smoking, completely stop smoking, eat healthy diet rich in fruits, vegetables, fiber, avoid salted and smoked and poorly preserved food, and eradication of H. pylori. So not only stomach cancer, the colon cancer also occurs. Again, it's one of the leading cause. Third, so it is also, there are one of the most preventable a cancer. This, we cannot change these factors: family history, age, gender, race, genetics, but definitely we can change the smoking, diet, physical, alcohol. So to reduce your risk of the developing cancer of the gastrointestinal tract or any part of the body, the adult should get moderate to vigorous activity for a minimum 30 to 45 minutes in 5 days a week. So it's shown to reduce the risk of breast colonic cancer, and children and adults should get at least 60 minutes a day of moderate to vigorous activity in 5 days a week. So reduce your risk, eat more vegetables and limit intake of red meat, maintain a healthy weight, balance calorie intake, increase physical activity, lose weight, and stop drinking and smoking. So this is about the awareness of the gastrointestinal tracts. Thank you. So our next speaker is Dr. T.N. Suresh, a professor. You will be giving information on oral cancer. Over to Suresh.
So good morning to all. So we'll discuss one more important cancer, which is most prevalent in India. especially in Kolar region. So you might have seen these pictures. This may be very familiar picture for you because when you are traveling or very near in a public place, so you might have seen these cancers, which is easily seen. So they are all called oral cancers because it's ranked as the first 3 topmost cancers in India, especially in Kolar. So for every 10 cancer patients, the 3 patients belongs to the oral cancers. So we'll discuss on this oral cancer, but I want all of you to type your questions so that we can concentrate on your doubts rather than any PPT presentations. So at least can you type hello or hi in the chat box so that I can know that all of you are listening. So please type in the chat at least hi. I am typing, so hopefully you also do it so that I know that I am not talking to the computer. I am talking to the student or a staff who is sitting across. So that's a disadvantage of a distant learning. So we will not know whether the others are listening or not. Okay, good. I can see some highs here. So keep typing your questions. I don't want to make any presentation here. I just want to here to discuss. So Dr. Shilpa will help me if there are any questions asked. So I will stop my presentation and answer your questions. So oral cancers are common, as I told you. Whenever you go to the doctor, first thing they do is they will take the history, they will feel your pulse, and they will ask you to show your oral cavity, open the mouth. So there are 2 important information you get it on oral examination. One is the nutritional status. So what is the nutritional status of the patient? So if it is a very healthy, it is shiny pink in color. Otherwise, it will be very white. So which tells you that the patient is having some anemia. Okay. So if it is a dry mouth, you know that the patient is having a dehydration. Probably patient may be having fever. But looking at the oral cavity, we know that how the nutritional status. ಕನ್ನಡದಲ್ಲಿ ಒಂದು ಗಾದೆ ಇದೆ, ಮಾತು ಬಲ್ಲವನಿಗೆ ರೋಗವಿಲ್ಲ, ಸಾರಿ ಊಟ ಬಲ್ಲವನಿಗೆ ರೋಗವಿಲ್ಲ, ಮಾತು ಬಲ್ಲವನಿಗೆ ಜಗಳವಿಲ್ಲ ಅಂತ. So when we use these unhealthy food habits, like a previous speaker also told, when you are eating a lot of bad foods or a toxic foods, so like all this tobacco smoking, tobacco chewing, and in various forms of eating tobacco like a gudka or a panpara, they cause a lot of changes in the oral cavity because they are all called carcinogens, andre cancer ಮಾಡುವ ವಸ್ತುಗಳು. So they causes the changes in the oral cavity. They may be in the form of a white patch, ಒಂದು ಬಿಳಿ patch ತರ ಕಾಣಬಹುದು. So that is the starting point of the cancer. ಇದನ್ನ ಕರೆಕ್ಟ್ ಆಗಿ ಡಾಕ್ಟರ್ಗೆ ತೋರಿಸಲಿಲ್ಲ ಅಂದ್ರೆ ಅಥವಾ ಟ್ರೀಟ್ಮೆಂಟ್ ತಗೊಳ್ಳಿಲ್ಲ ಅಂದ್ರೆ it will go to the advanced stage. So this is very a bad stage. So that's what the doctor says, it's a 4th stage or a inoperable stage where there is no definite treatment. The patient will have a bad prognosis. We all know oral cancers, the leading cause is tobacco smoking, but it is not that all truth. Apart from this tobacco, we need to have other 2 factors. One is a susceptible person, andre some character of a person, and also the environmental factors. Susceptible person andre avarge apart from tobacco smoking, they should also have some other risk factors, maybe unhealthy food habits, or already suffering from other diseases and other associated factors like alcohol and the family history of cancers, and also unhealthy lifestyle. Environment factors also play a role, especially those who are in the city life where they are already exposed to a lot of the carcinogens. They are at the higher risk. So cigarette smoking is not the only factor, but when it's clubbed with the other unhealthy habits, definitely it causes the cancers. Cancer will not develop overnight. ಅಂದರೆ ಇವತ್ತು ಸ್ಮೋಕ್ ಮಾಡಿದ್ರೆ ನಾಳೆ ಬರೋದಿಲ್ಲ. ಅದಕ್ಕೆ ಎಷ್ಟು ಜನ ಸ್ಮೋಕಿಂಗ್ ಮಾಡ್ಕೊಂಡೇ ಹೋಗ್ತಾರೆ. ಓನ್ಲಿ ಆಫ್ಟರ್ 5 to 10 years ಇದು ಸ್ಮಾಲ್ ಪ್ಯಾಚ್ ತರ ಶುರು ಆಗುತ್ತೆ. ಬಟ್ ಅದನ್ನ ಕಂಟಿನ್ಯೂ ಮಾಡ್ತಾ ಮಾಡ್ತಾ ಸೊ ದೊಡ್ಡ ಪ್ಯಾಚ್ ಆಗುತ್ತೆ. ಆಮೇಲೆ ಈ ತರ ಅಲ್ಸರ್ಸ್ ಆರ್ ಎ ನಾಡ್ಯೂಲ್ ಆಗುತ್ತೆ. ಇದೆಲ್ಲ 5 to 10 years ಆಗುತ್ತೆ. ಮೈಕ್ರೋಸ್ಕೋಪ್ ಅಲ್ಲಿ ನಾವು ನೋಡಿದಾಗ ಸೊ ದೇರ್ ಆರ್ ಸಮ್ ಚೇಂಜಸ್ ಕಾಲ್ಡ್ ಡಿಸ್ಪ್ಲೇಸಿಯಾ. ಅಂದ್ರೆ ಆ ಎಪಿಥೀಲಿಯಂ ಇರುತ್ತಲ್ಲ, ಓರಲ್ ಕ್ಯಾವಿಟಿ ಎಪಿಥೀಲಿಯಮ್, ಸ್ಕ್ವಾಮಸ್ ಎಪಿಥೀಲಿಯಮ್, ಅಲ್ಲಿ ಚೇಂಜಸ್ ಆಗುತ್ತೆ. ಅದನ್ನ ಅರ್ಲಿ ಸ್ಟೇಜಸ್ ಅಲ್ಲೇ ಎಕ್ಸಾಮಿನೇಷನ್ ಮಾಡೋದ್ರಿಂದ ನಾವು ಗುರ್ತು ಹಚ್ಬೋದು. So I already told that in Kolar there are 30% of all cancers is oral cancers. Oral cavity ಅಲ್ಲಿ ಅದು ಮೇನ್ಲಿ ಬಕಲ್ ಮ್ಯೂಕೋಸಾದಲ್ಲಿ ಇರುತ್ತೆ, ತಪ್ಪಿದ್ರೆ ಟಂಗ್ ಅಲ್ಲಿ ಇರುತ್ತೆ. ಇದನ್ನ ಗುರ್ತು ಹಚ್ಚೋದು ಬಹಳ ಈಸಿ, ಯಾಕಂದ್ರೆ ಓರಲ್ ಎಕ್ಸಾಮಿನೇಷನ್ ಆರಾಮ್ಸೆ ಮಾಡ್ಬೋದು. ಅದು ನಾನ್ ಹೀಲಿಂಗ್ ಅಲ್ಸರ್ ತರ ಬರ್ಬೋದು, ಅಂದ್ರೆ ಒಂದು ಹುಣ್ಣಾಗ್ಬಿಟ್ಟು ಅದು ಎಷ್ಟೇ ದಿನ ಆದ್ರೂ ಹೋಗದಲ್ಲೇ ಇರೋದು. ಇನ್ನೊಂದು ಕಾಲಿಫ್ಲವರ್ ಲೈಕ್ ಗ್ರೋತ್, ಅಂದ್ರೆ ನಾಡ್ಯೂಲ್ ತರ ಆಗ್ಬೋದು. ಸೊ ಈ ಪೇಷಂಟ್ಸ್ಗಳು ಯೂಶಲಿ ದೇ ವಿಲ್ ಹ್ಯಾವ್ ಎ ಲಾಸ್ ಆಫ್ ವೆಯ್ಟ್, ಅನ್ಎಕ್ಸ್ಪ್ಲೈನ್ಡ್ ಲಾಸ್ ಆಫ್ ವೆಯ್ಟ್. ಅಂದ್ರೆ ಅವರು ಊಟ ಚೆನ್ನಾಗಿ ಮಾಡ್ತಾ ಇದ್ರು ಅವರು ಮೋರ್ ದೆನ್ 10% ಆಫ್ ಬಾಡಿ ವೆಯ್ಟ್ ನ ಲೂಸ್ ಮಾಡ್ತಾರೆ. and usually they will be very weak, so they will be not interested in the general activity and frequently sick. ಇದನ್ನ ಡಯಾಗ್ನೋಸ್ ಮಾಡೋದು ರಿಲೇಟಿವ್ಲಿ ಈಸಿ, ಯಾಕೆಂದ್ರೆ ಇದನ್ನ ಓರಲ್ ಎಕ್ಸಾಮಿನೇಷನ್ ಇರೋದ್ರಿಂದ ಆ ಟೈಮಲ್ಲಿ ಏನಾದರೂ ವೈಟ್ ಪ್ಯಾಚಸ್ ತಪ್ಪರೆ ಅಲ್ಸರ್ಸ್ ಕಂಡ್ರೆ ಅದರಿಂದ ಲೋಕಲ್ ಅನೆಸ್ಥೀಸಿಯಾ ಅಂದ್ರೆ ಅಲ್ಲೇ ಒಂದು ಇಂಜೆಕ್ಷನ್ ಕೊಟ್ಟು ಒಂದು ಬಯಾಪ್ಸಿನ ತೆಗಿಬಹುದು. ಇದನ್ನ ಮೈಕ್ರೋಸ್ಕೋಪ್ ಅಲ್ಲಿ ನೋಡಿದಾಗ ಕೆಲವು ಚೇಂಜಸ್ ಕಾಣುತ್ತೆ. ದಟ್ಸ್ ವಾಟ್ ಪೆಥಾಲಜಿಸ್ಟ್ ಡು, ವಿಲ್ ಟೆಲ್ ವೆದರ್ ಇಟ್ಸ್ ಅ ಕ್ಯಾನ್ಸರ್ ಆಲ್ರೆಡಿ ಡೆವಲಪ್ ಆರ್ ಇನ್ ದ ಇನಿಷಿಯಲ್ ಸ್ಟೇಜ್. ಇನಿಷಿಯಲ್ ಸ್ಟೇಜಸ್ ಅಂದ್ರೆ ಬಹಳ ಒಳ್ಳೆಯದು, ಅದನ್ನು ಲೋಕಲ್ ಟ್ರೀಟ್ಮೆಂಟ್ ಅಲ್ಲೇ ಮಾಡ್ಬೋದು. ಬಟ್ ನಮಗೆ ಬರೋ ಕೇಸಸ್ ಕೋಲಾರದಲ್ಲೆಲ್ಲ ಅಡ್ವಾನ್ಸ್ ಸ್ಟೇಜ್. 80% ಆಫ್ ದಿ ಕ್ಯಾನ್ಸರ್ಸ್ ಆರ್ ಇನ್ ದ ಅಡ್ವಾನ್ಸ್ ಸ್ಟೇಜ್. ಅವ್ರಿಗೆ ಯೂಶಲಿ ಎಕ್ಸ್ಟೆನ್ಸಿವ್ ಸರ್ಜರಿ ಬೇಕಾಗುತ್ತೆ. ಕೆಲವು ಟೈಮ್ ಸರ್ಜರಿ ಜೊತೆ ಕರೆಂಟ್ ಕೊಡಬೇಕಾಗುತ್ತೆ. ಅದಕ್ಕೆ ದಟ್ಸ್ ವಾಟ್ ವಿ ಕಾಲ್ ಇಟ್ ಎಸ್ ಅ ರೇಡಿಯೇಷನ್. ಸಮಟೈಮ್ಸ್ ಸ್ಟಿಲ್ ವರ್ಸ್ we have to give a chemotherapy. Chemotherapy means cancer killing drugs which are harmful to the body. So ಕೆಲವು ಟೈಮ್ ಆಲ್ ದ 3 ಕೊಡಬೇಕಾಗುತ್ತೆ. ಆಪರೇಷನ್ ಅಂದ್ರೆ ನಿಮ್ಗೆ ಗೊತ್ತಿರಬೇಕು, ಸಿಸೇರಿಯನ್ ಆಪರೇಷನ್ ಮಾಡ್ತಾರೆ, ಕೆಲವು ಬೇರೆ ಆಪರೇಷನ್ ಮಾಡ್ತಾರೆ. ಬಟ್ ಕ್ಯಾನ್ಸರ್ ಆಪರೇಷನ್ಸ್ ಆರ್ ವೆರಿ ಬ್ಯಾಡ್. ಅಂದ್ರೆ ಬಹಳ ದೊಡ್ಡ ಆಪರೇಷನ್ಸ್ ಇರುತ್ತೆ, 4 to 6 hours. ಈ ಪೇಷಂಟ್ ನೋಡಿದ್ರೆ ಈ ಬ್ಲೂ ಇಂಕಲ್ ತೋರಿಸಿದ್ದಾರೆ. ಸೊ ದೇರ್ ವಿಲ್ ಬಿ ಎಕ್ಸ್ಟೆನ್ಸಿವ್ ಸರ್ಜರೀಸ್ where they will have a big scar on the mouth. ಅಂದ್ರೆ ಅವರಿಗೆ ಸೋಷಿಯಲ್ ಸ್ಟಿಗ್ಮಾನು ಆಗ್ಬಿಡುತ್ತೆ, ದೇ ಕೆನಾಟ್ ಗೋ ಔಟ್ ಈಸಿಲಿ. ಕೆಲವು ಟೈಮಲ್ಲಿ ಆ ಮ್ಯಾಂಡಿಬಲ್ ಜಾ ಬೋನ್ ಅಂತೀವಲ್ಲ ಅದಕ್ಕೂ ಸಹ ತೆಗಿಬೇಕಾಗುತ್ತೆ. ಸೊ ಅವ್ರಿಗೆ ನೆಕ್ಸ್ಟ್ ಊಟ ಮಾಡೋದಕ್ಕೂ ಕಷ್ಟ ಆಗುತ್ತೆ. ಸೊ ಓರಲ್ ಕ್ಯಾನ್ಸರ್ಸ್ ಆರ್ ಟ್ರೀಟೆಡ್ ವಿತ್ ಎಕ್ಸ್ಟೆನ್ಸಿವ್ ಸರ್ಜರೀಸ್ ವಿಚ್ ಕಾಸಸ್ ದಿ ಮ್ಯುಟಿಲೇಷನ್ ಆಫ್ ದಿ ಫೇಸ್. ಇದ್ರ ಜೊತೆ ಕೆಲವು ಟೈಮ್ ನಾವು ರೇಡಿಯೇಷನ್ ಕೊಡಬೇಕಾಗುತ್ತೆ. ರೇಡಿಯೇಷನ್ಗೆ ಒಂದು ಸೈಡ್ ಎಫೆಕ್ಟ್ಸ್ ಅಂತ ಇರುತ್ತೆ. ಕೆಲವು ಟೈಮು ಅಡ್ವಾನ್ಸ್ ಸ್ಟೇಜ್ ಬಂದಾಗ, ಆಲ್ರೆಡಿ ಭಾಳ ಸ್ಪ್ರೆಡ್ ಆದಾಗ, ದಟ್ಸ್ ವಾಟ್ ಯು ಕಾಲ್ ಇಟ್ ಎಸ್ ಅಡ್ವಾನ್ಸ್ ಸ್ಟೇಜ್. ಅದಕ್ಕೆ ಆಪರೇಷನ್ ಮಾಡೋಕ್ಕಾಗಲ್ಲ, ಅದಕ್ಕೆ ಏನು ಟ್ರೀಟ್ಮೆಂಟು ಕೊಡೋಕ್ಕಾಗಲ್ಲ. ಜಸ್ಟ್ ಎ ಪ್ಯಾಲಿಯೇಟಿವ್ ಟ್ರೀಟ್ಮೆಂಟ್, ಅಂದರೆ ಅವ್ರಿಗೆ ನೋವು ಇದ್ರೆ ನೋವಿಗಷ್ಟೇ ನಾವು ಔಷಧಿಗಳನ್ನ ಕೊಡಬೇಕಾಗುತ್ತೆ. ಸೊ ದಿಸ್ ಇಸ್ ಅ ಸ್ಟೇಜ್ ವೇರ್ ವಿ ಸೇ ದಟ್ ಸೊ ನಥಿಂಗ್ ಕ್ಯಾನ್ ಬಿ ಡನ್, ಜಸ್ಟ್ ಪ್ರೊಲಾಂಗ್ ದಿ ಲೈಫ್. ಸೊ ನೋಬಡಿ ಶುಡ್ ರೀಚ್ ದಿಸ್ ಸ್ಟೇಜ್. ಸೊ ವಿ ಹ್ಯಾವ್ ಟು ಡೂ ದಿ ಪ್ರಿವೆನ್ಷನ್ ಈಸ್ ಬೆಟರ್ ದೆನ್ ಕ್ಯೂರ್ ಅನ್ನೋದು ಕ್ಯಾನ್ಸರಲ್ಲಿ ಬರುತ್ತೆ. ಕ್ಯಾನ್ಸರ್ ಈಸ್ ಎ ಲೈಫ್ ಸ್ಟೈಲ್ ಡಿಸಾರ್ಡರ್, ಅಂದರೆ ನಾವು ಹುಟ್ಟಾಗಿ ಇರೋದಿಲ್ಲ, ಅದು ನಾವು ತರಿಸ್ಕೊಳ್ಳೋ ಅಂಥ ರೋಗ. ಸೊ ಅದಕ್ಕೋಸ್ಕರ ನಾವು ಹೆಲ್ತಿ ಲೈಫ್ ಸ್ಟೈಲ್ ಮಾಡಿರೋದ್ರಿಂದ ಡಾಕ್ಟರ್ ಹರೇಂದ್ರ ಕುಮಾರ್ ಆಗಲೇ ಹೇಳಿದ್ರು, ಯು ಶುಡ್ ವಾಚ್ ವಾಟ್ ಯು ಈಟ್ ಆ್ಯಂಡ್ ವಾಟ್ ವಿ ಡೂ ರೌಟಿನ್ ಆ್ಯಕ್ಟಿವಿಟಿ. ಅದರಿಂದ ಭಾಳ ಈಸಿಯಾಗಿ ಕ್ಯಾನ್ಸರ್ನ ದೂರ ಮಾಡ್ಬೋದು. ಸೊ ದಯವಿಟ್ಟು ಯಾವ್ದಾದ್ರು ಕ್ವಶನ್ಸ್ ಕೇಳಿ, ನಾವು ಡಿಸ್ಕಸ್ ಮಾಡ್ಬೋದು. ಸೊ ಇದೆಲ್ಲ ಕ್ಯಾನ್ಸರ್ ಬಗ್ಗೆನೇ ಹೇಳ್ತಾ ಇದ್ದೀವಿ. ಸೊ ನೀವು ನಿಮ್ಮ ಮನೆ ಹತ್ರ ಎಲ್ಲ ನೋಡಿರ್ತೀರಾ ಕ್ಯಾನ್ಸರ್ಸ್ನ. ಸೊ ನಿಮ್ಗೆ ಏನಾದರೂ ಕ್ವಶನ್ಸ್ ಇದೆಯಾ? ಚಾಟ್ ಬಾಕ್ಸಲ್ಲಿ ನೀವು ಟೈಪ್ ಮಾಡ್ಬೋದು. ಎನಿ ಕ್ವಶನ್ಸ್ ಯು ಹ್ಯಾವ್ ರಿಗಾರ್ಡಿಂಗ್ ಕ್ಯಾನ್ಸರ್ಸ್, ಓರಲ್ ಕ್ಯಾನ್ಸರ್ಸ್ ಆರ್ ಎನಿ ಅದರ್ ಕ್ಯಾನ್ಸರ್ಸ್, ಸೊ ದಟ್ ವಿ ನೋ ದಟ್ ಯು ಆರ್ ಆಲ್ ಲಿಸ್ನಿಂಗ್. Any questions? You know how to type it in the chat box, I am sure. So online classes ನಡೀತಾ ಇರುತ್ತಲ್ಲ, ಒಂದ್ಸರಿ ಕ್ಯಾನ್ಸರ್ ನೀವು ಹಾಸ್ಪಿಟ್ಲಿಗೆ ಬಂದಾಗಲೂ ಒಂದು ತೋರಿಸಿ ಕೊರೋನಾ ಆದಮೇಲೆ ಬೇಕಾದ್ರೆ ಬಂದು ನೋಡ್ಬೋದು. ಸೊ ದಟ್ಸ್ ಎ ಬಿಗ್ ವಿ ಕ್ಯಾನ್ ಡೂ ದ ಟೂರ್ ಹಿಯರ್ ಆ್ಯಂಡ್ ಯು ವಿಲ್ ಸಿ ಲಾಟ್ ಆಫ್ ದೀಸ್ ಕೇಸಸ್ routinely ಹಿಯರ್. ನಮಗೆ ಬರೋದಿಲ್ಲ ಅಂತ ಹೇಳಕ್ಕೆ ಬರೋದಿಲ್ಲ. ಸೊ ಎವ್ರಿಬಡಿ ಈಸ್ ಅಟ್ ರಿಸ್ಕ್. ಸೊ ನೋ ಕ್ವಶನ್ಸ್? Okay, please ask questions, otherwise we don't get interest to discuss. So that is the only way we can learn each other. Okay, keep posting questions.
There is difference between oral cancer and gland cancer.
Gland cancer, okay. ಓರಲ್ ಕ್ಯಾನ್ಸರ್ಸ್ ಅಂದರೆ ಅದು ಮ್ಯೂಕೋಸಲ್ ಕ್ಯಾನ್ಸರ್ಸ್ ಅಂತ ಹೇಳ್ತೀವಿ. ಗ್ಲ್ಯಾಂಡ್ ಅಂದರೆ ಬಾಯಲ್ಲಿ ಜ್ಯೂಸ್ ಬರೋ ಥರ ಭಾಳ ಗ್ಲ್ಯಾಂಡ್ಸ್ಗಳಿದ್ದಾವೆ, ಅದು ಸಲವರಿ ಗ್ಲ್ಯಾಂಡ್ ಅಂತ ಹೇಳ್ತೀವಿ. ಅದು ಸಹ ಕ್ಯಾನ್ಸರ್ಸ್ ಬರುತ್ತೆ, ಸಲವರಿ ಗ್ಲ್ಯಾಂಡ್ ಅಂತ. ಅದು ಕಾಮನ್ ಇರೋದಿಲ್ಲ, ಬಟ್ ಡೆಫಿನೆಟ್ಲಿ ದೇರ್ ಇಸ್ ಕಾಲ್ಡ್ ಗ್ಲ್ಯಾಂಡ್ ಕ್ಯಾನ್ಸರ್. ನಾವು ಟೆಕ್ನಿಕಲ್ ಆಗಿ ಅಡಿನೋಕಾರ್ಸಿನೋಮಾ ಅಂತ ಹೇಳ್ತೀವಿ. ಆ ಕ್ಯಾನ್ಸರ್ಸ್ಗಳು ಬಾಯಲ್ಲಿ ಆಗುತ್ತೆ, ಬಟ್ ಕಾಮನ್ ಆಗಿ ಆಗೋದು ಮ್ಯೂಕೋಸಲ್ ಕ್ಯಾನ್ಸರ್ಸ್. ಓಕೆ, so that's a small information. Salivary gland cancers also happens. Any other questions? Okay, keep postings, we can tell you the later. Now I request Dr. S. Das, so the professor of pathology, ಅವರು ನಿಮಗೆ one of the important cancers ಅಂದರೆ ಬ್ಲಡ್ ಕ್ಯಾನ್ಸರ್ಸ್ ಅಂತ ಕೇಳಿರ್ಬೋದು. ಸೊ ಬ್ಲಡ್ ಕ್ಯಾನ್ಸರ್ಸ್ ಬಗ್ಗೆ ನಿಮಗೆ ಹೇಳ್ಕೊಡ್ತಾರೆ. ಥ್ಯಾಂಕ್ ಯು.
Good morning, students. I'm going to speak very briefly on hematological malignancies. And hematological malignancy is defined as a malignancy of any of the formed elements of blood. So normally what we call as blood cancer is nothing but the same hematological malignancies. They are of two types: lymphomas broadly and leukemias. And lymphomas, again very briefly, can be subdivided into Hodgkin's and non-Hodgkin's. Leukemias can also be subdivided into chronic and acute. So when we see leukemias and lymphomas, they are all various forms of blood cancers. Now coming to hematological malignancies, they all originate from the bone marrow. They have the malignant stem cell, then they have the malignant progenitor cells, and from the progenitor cells, the malignant cell clone arises. So this is the basic pathology of leukemias. So of the various leukemias that can arise from the bone marrow includes the essential thrombocytopenia, the polycythemia, myelofibrosis, and if it involves the red cells, it is called as myelodysplastic syndromes. If it involves the white cells, it is called as acute myelogenous leukemia or AML. So this is very brief. And now the next slide will show you the group of cancers that affect the blood, the lymph nodes and the bone marrow. It accounts for less than 9% of new cancers in the USA. There are three major groups in hematological malignancies or blood cancer. Leukemia, that is, it starts in the bone marrow and spreads to the blood. Lymphoma occurs in the lymphoid tissue, and plasma cell neoplasm, which is nothing but multiple myelomas. Now, this is just a flow chart to show you. This is the stem cell. We have the lymphoid series as well as the myeloid series. From the lymphoid series, we get to see the T cells and the B cells. And from the myeloid series, we get to see the myeloblast, mast cells, erythrocytes, and megakaryocytes. Myeloblasts are further subdivided into basophils, neutrophils, eosinophils, monocytes. And from that monocyte comes the macrophages. So these are the, in brief, very briefly, these are the various types of cells from where the leukemia or the blood cancer arises. As I told in the earlier slide, bone marrow and lymphoid is involved in leukemia. Bone marrow is responsible for the lymphoid progenitor, for progenitor B, precursor B, and immature B cells. Lymphoid tissue is responsible for mature B cells, germinal center B cells, memory B cells, and plasma cells. So this is the basic pathology. This is the basic anatomy from where the various cancer cells originally derive from. Now coming to the lymph nodes. What are the lymph nodes? This stores the white blood cells and also helps in removal of substances from the body. Now coming to spleen, they helps the body fight infection, filters damaged cells, bacteria, cell waste out of the blood. Coming to bone marrow, they make the red cells, white cells, and the platelets. Now a patient developing leukemias or blood cancer will have these various symptoms. So some of the symptoms include, it starts from psychological, they may feel fatigue and loss of appetite, or it may be systematic where we have the weight loss, fever, and frequent infections. Sometimes the lymph nodes get involved, swelling is there. Sometimes the lung gets involved where there is shortness of breath. Sometimes there is muscles involvement with muscular weakness. Spleen is enlarged. Skin is also involved, giving rise to night sweats, easy bleeding and bruising, along with purplish spots. Liver is also involved, giving rise to enlargement, and bones and joints are also involved, giving rise to pain or tenderness. Now, what are the signs? The patient will have these important signs: loss of weight, but unexplained. Suddenly, the patient will complain of loss of weight. Then he will be feeling worn out or tired because of no reason. He will be having a lump in the neck or in the armpit or in the groin. Suddenly, he will be detecting it. Then he will be having itching all over the body without any reason. And sometimes he will be drenched in sweat during the night time. So these are very, very minor signs in the initial symptoms, in the initial days the patient may have. Now, what are the risk factors that give rise to leukemia? Chemical exposure, radiation, infection, previous chemotherapy, genetic conditions, smoking, and certain races are the predisposing factors which are responsible for leukemia to occur. So these are the things which can ensure that leukemia can develop over a period of time. Now, investigations, blood investigation is very, very necessary for diagnosis of leukemia. So we collect the blood and separate it into various components. Then bone marrow aspiration is also very, very important. Here we do the bone marrow aspiration to see the leukemic cells. Then clinically staging of lymphoma is also very important. In which stage? Stage 1, stage 2, stage 3, and stage 4. This depends upon whether the patient will survive or not and for how long. Then when we do the microscopy, we get to see various sort of abnormal cells, the cancer cells. The various cancer cells can look like this: blast, granular, agranular, and promyelocytic and abnormal promyelocytic. They can be basophilic, they can be azidophilic, or they can have vacuoles in them. So these are all abnormal malignant cells that can be seen under microscopy in case of leukemia and blood cancer. Now, what is a myeloblast and a lymphoblast? That is very briefly, myeloblast is something which is bigger cells with granules are called as myeloblast. Smaller cells without granules are called as lymphoblast. This is the microscopic features of various cancer cells. Coming to treatment, stem cell involvement is the ultimate treatment. There are many modes of treatment. Without going into the details, ultimately it is the stem cell which helps in ultimate treatment of leukemias and lymphomas. So this is a picture showing you how stem cell treatment is carried out. So leukemias and lymphomas are not only involved the bone marrow and the blood, sometimes they involve the skin. So this is also seen here as a case of Sézary syndrome, where the skin involvement can also occur. Skin itching, ulceration can also take place. Sometimes in children, we have lymphoblastic leukemia and bone pain, because most of the cancers that has been discussed predominantly affects the adults. But cancer, particularly the blood cancer, can also affect children. Children are also very high risk for developing blood cancer. So there also they have the following symptoms, which includes headache, seizures, anemia, cough, lack of appetite, skin rash, frequent infection, fatigue and swelling, and bone pain. This is a case of his children having a cheek swelling, ulcerated swelling. This is also a manifestation of leukemia or blood cancer. Lymphoma, this is a case of Burkitt's lymphoma, showing a static. This is the microscopic picture. When under the microscope, we get to see these sort of pictures. The last slide. There's nothing to lose hope if you have developed cancer, because cancer treatment and diagnosis are well developed, and if treated early and diagnosed early, cancer people have a good chance of survival. Thank you. Thank you, students. My next speaker is Dr. Manjula. She is professor of pathology, and she is going to speak on lung, bone, and CNS tumors. Thank you once again.
Good morning. I'm Dr. Manjula, Professor of Pathology, and I'll be talking on another three important organs of our body: lung, bone, and brain cancers. Andre ಮೂಳೆ ಕ್ಯಾನ್ಸರ್, ಮತ್ತೆ ಶ್ವಾಸಕೋಶದ ಕ್ಯಾನ್ಸರ್, ಮತ್ತೆ brain cancer. So I'll be talking under the following headings: the incidence of cancers, specific cancers, the risk factors for cancer, clinical features, lab diagnosis, and treatment in a brief manner. So lung, it's one of the most important organ of body. It is the most important cause of mortality and morbidity, and it accounts to almost like 5.9%, almost 6% of total cancers, and accounting to 8.1 cancers when you compare with the total death rates because of cancers. Then what are the risk factors for cancers? Lung cancers. The most common risk factor, almost accounting to 90%, is smoking, cigarette smoking. Okay. Other than that, the next common is the radiation exposure and occupational disorders, like persons who are working in industries, asbestosis. So that is the third most common. Other than that, patient may have the genetic exposure and other causes as risk factor for the development of lung cancers. So ಇದರಲ್ಲಿ ಸ್ಮೋಕಿಂಗ್ ಮೋಸ್ಟ್ ಇಂಪಾರ್ಟೆಂಟ್ ಕಾಸ್, ಅದಾದ್ಮೇಲೆ ರೇಡಿಯೇಷನ್ ಎಕ್ಸ್ಪೋಜರ್, ಆಮೇಲೆ ಆಕ್ಯುಪೇಷನಲ್, ಎಲ್ಲಿ ಕೆಲಸ ಮಾಡ್ತಾರೆ, ಎಷ್ಟು ವರ್ಷ ಕೆಲಸ ಮಾಡ್ತಾರೆ, ಅದೆಲ್ಲ ಇಂಪಾರ್ಟೆಂಟ್. ಓಕೆ. Then what are the symptoms with which these patients may come with? The common symptoms of lung cancers. So patient may have persistent cough. So you would have undergone, you may get investigated and exact cause of cough will not be known. Or breathlessness, continuous breathlessness, or sometimes vomiting of blood, coughing of blood. ಸ್ಫುಟಮಲ್ಲಿ ಕಫದಲ್ಲಿ ರಕ್ತ ಕಾಣಿಸ್ಕೋಬಹುದು. ಅಥವಾ generalized symptoms like unexplained weight loss, which can be seen in other malignancies, or vague symptoms. Patient may come with history of pain, radiating pain, pain in arm, chest, back pain, atara, ಅಥವಾ repeated infections. Okay. Even with the course of antibiotics, patient may get repeated infections. So when a patient comes with all these features, repeated infections, persistent cough, and coughing of cough with where you see presence of blood in cough, the sputum, so all such cases has to be investigated for malignancy. Then what are the methods of investigation? How we can detect these malignancies, lung cancers? So one is physical examination. So when a clinician sees the patient, because of certain signs and symptoms, he may suspect malignancy of lung, and he may ask you to undergo certain investigations like chest x-ray, CT scan, and lung biopsy, where we take some material from the lung and it will be sent for histopathological examination to look for any malignant cells. Athwa they can also ask for what we call as pulmonary function test. Okay. So first basic thing is physical examination of the individual, which is followed by chest x-ray, CT scan, biopsy. Adadmele sometimes we confirm with pulmonary function test. Okay. These are the investigations which are commonly advised when you suspect, when the consultant suspect malignancy in a lung cancers. So this is a specimen of a lung. So here what you have to observe is, so this is a normal gray brown area in nodta idira, adu normal tissue. So if you compare this normal tissue, so you are seeing this gray white areas. So sort of a nodules, round whitish areas ಕಾಣ್ತಿದೆಯಲ್ಲ, so ಇದೆಲ್ಲ tumor component. So when you're seeing such multiple areas in a normal lung, so this we call it as a malignancy. Okay. So the initially small nodule ತರ ಇರುತ್ತೆ. So as the disease progresses, it can attain large sizes, and the secondary changes like hemorrhage, necrosis ಎಲ್ಲ ಆಗ್ಬೋದು. Okay. So in the initial stage, one sun nodule ತರ ಇರುತ್ತೆ. As the disease progresses, it will attain multiple foci. You may see involvement of multiple areas in a lung. Okay, idina depends upon the stage of the disease. Okay. Stage of the disease is important for the treatment of individual. ಇದು ಮತ್ತೊಂದು ಲಂಗ್ ಇಮೇಜು. ಇದರಲ್ಲೂ ಅಷ್ಟೇ, ಯು ಕ್ಯಾನ್ ಸಿ ಮಲ್ಟಿಪಲ್ ಗ್ರೇ ವೈಟ್ ನಾಡ್ಯೂಲ್ಸ್ ವಿಚ್ ಆರ್ ವೇರಿಂಗ್ ಫ್ರಮ್ ಫ್ಯೂ millimeter to almost like up to 5, 6 or sometimes 8 centimeter with a central area of necrosis. So that's what I told you. Initially, they are very small nodule. The lesion will be very small. So as the disease progresses, the number of nodules, size of the nodules and secondary changes will happen. So what are the treatment aspects? How we are going to treat the lung cancers? The first and foremost, again, for all these things, what is important is stage of the disease, okay? So there is stage 1 to stage 4. Stage 1 antandre where the lesion is confined to the lung. Andre lungal matra irutte bede kade ellu spread agirodilla. And the stage 4 antandre already lung bittu bere organs. So it could have involved the other areas, distant organs. That stage 4 agutte. So if it is in a stage 1, so it can be removed. The involved lung portion can be removed. Okay. Other stage 1, stage 2 agutte. If the patient is in stage 3, stage 4, so we have to think of other alternatives. Like we can give chemotherapy, immunotherapy, athwa target therapy. So idella bere modalities of treatment. Okay. And treatment depends upon the stage of the disease. ಈಗ ಬೋನ್ ಟ್ಯೂಮರ್ಸ್ ಡಿಸ್ಕಸ್ ಮಾಡೋಣ. ಸೊ ಬೋನ್ ಆಲ್ ಆಫ್ ಯು ನೋ ಅಗೇನ್ ಇಟ್ ಇಸ್ ಎ ವೈಟಲ್ ಆರ್ಗನ್ ಇನ್ ಅವರ್ ಬಾಡಿ, ಸೊ ವಿಚ್ ಈಸ್ ನೆಸೆಸರಿ ಫಾರ್ ಮೋಸ್ಟ್ ಆಫ್ ದ metabolisms, okay, mineral metabolism, hematopoiesis. So it's one of the vital organ in our body. So what is a bone tumor or cancer? Again, it is nothing but abnormal uncontrolled growth of malignant cell, okay. So it's a normal bone. So if you're seeing some growth, we call it as a tumor or malignancy. So all of you know, there are various cell types in bone. We call it as osteogenic cell, osteoblast. So why it is important? Because malignancy can, or the neoplasm can occur involving the various type of bone cells. So idu niಮಗೆ ಗೊತ್ತಿರುತ್ತೆ, there are various types of bones. We have short bones, ಕೈಯಲ್ಲಿ ಮತ್ತೆ ಕಾಲಲ್ಲಿ ಇರುತ್ತಲ್ಲ ಅದನ್ನ ಶಾರ್ಟ್ ಬೋನ್ಸ್ ಅಂತೀವಿ, ಫ್ಲಾಟ್ ಬೋನ್ಸ್ ಅಂಡ್ ಇರ್ರೆಗ್ಯುಲರ್ ಬೋನ್ಸ್ ಅಂಡ್ ಆಲ್ಸೋ ಲಾಂಗ್ ಬೋನ್ಸ್. ಓಕೆ, ಸೊ ಇದು ಯಾಕೆ ಇಂಪಾರ್ಟೆಂಟ್ ಅಂತಂದ್ರೆ ಬೋನ್ ಟ್ಯೂಮರ್ಸ್ ಸೊ ಡಿಪೆಂಡ್ಸ್ ಅಪಾನ್ ದ ಲೊಕೇಶನ್. ಸೊ ಎಲ್ಲಿ ಟ್ಯೂಮರ್ ಅರೈಸ್ ಆಗ್ತಿದೆ ಮತ್ತೆ ಯಾವ ಏರಿಯಾ ಇಂದ ಎಕ್ಸ್ಟೆಂಡ್ ಆಗ್ತಿದೆ, ಎಲ್ಲಿವರೆಗೂ ಎಕ್ಸ್ಟೆಂಡ್ ಆಗ್ತಿದೆ, ಯಾವ ಬೋನ್ಸ್ ಕಾಮನ್ಲಿ ಇನ್ವಾಲ್ವ್ ಆಗಿದೆ, ಅದೆಲ್ಲ ಇಂಪಾರ್ಟೆಂಟ್ ಫಾರ್ ಡಯಾಗ್ನೋಸಿಸ್ ಆಸ್ ವೆಲ್ ಆಸ್ ಟ್ರೀಟ್ಮೆಂಟ್. ಅದಕ್ಕೆ ಬೋನ್ ಮಾರ್ಫಾಲಜಿ ತುಂಬಾ ಇಂಪಾರ್ಟೆಂಟ್ ನಮಗೆ. So going to, so what are the causes for bone cancers? Like any other malignancy, namge most important, patient age is important. Whether patient relatives have any genetic abnormality or the incidence of malignancy in the family is important. Whether patient has the underlying disorders, like we call it as a Paget disease. If the patient has is a known case of Paget disease, they will have more chance of bone malignancies. Athwa whether the individual has exposure of radiation. So these are the risk factors for bone tumors. Then what are the symptoms with which this bone cancer patients can come? So like any other malignancy, they may come with history of generalized fatigue or weight loss, or sometimes local symptoms. Like patient may come with history of swelling, or sometimes may come with history of multiple bone fractures, athwa just bone pain. Patient may come to us with just a pain in the bone. So these are the various symptoms with which bone neoplasm or malignancy can come present with. So bone like any other malignancy, bone alli ಎರಡು types ಇದೆ. Benign tumors ಅಂತಂದ್ರೆ they have a better prognosis. Okay, small tumors and better survival if they are benign tumors. Malignant antandre they are real cancer tumors, they are very large tumors and prognosis is very bad. Okay, the list is very big. So to name certain examples for benign tumors, osteochondroma atara, osteoid osteoma idella benign tumors. Whereas osteosarcoma, chondrosarcoma, so ಈ sarcoma carcinoma idella malignancy. Okay, it signifies malignancy. So when we are talking about bone tumors, what is important in treatment as well as prognosis is what is the age of patient, where is the location, what is the exact location of the tumor, and we have to correlate with other investigations like radiological appearance. ಹೇಗಿದೆ ರೇಡಿಯಾಲಜಿ, ಎಕ್ಸ್ರೇ ಹೇಗಿದೆ ಅದಕ್ಕೆಲ್ಲ ಕೋರಿಲೇಟ್ ಮಾಡಿಕೊಂಡು ನಾವು ಡಯಾಗ್ನೋಸಿಸ್ ಮಾಡಬೇಕಾಗುತ್ತೆ. ಅಂಡ್ ಅದಕ್ಕೆ ಇನ್ನೊಂದು ಇಂಪಾರ್ಟೆಂಟ್ ಆಸ್ಪೆಕ್ಟ್ ಅಂದರೆ ಹಿಸ್ಟಲಾಜಿಕಲ್ ಫೀಚರ್ಸ್. ಸೊ ಹೇಗಿದೆ ಅದರ ಮೈಕ್ರೋಸ್ಕೋಪ್ ಮೇಡಮ್ ಎಲ್ಲ ನಿಮ್ಗೆ ಎಕ್ಸ್ಪ್ಲೇನ್ ಮಾಡಿದ್ದಾರೆ. ಸೊ ವಾಟ್ ಈಸ್ ದ ಅಪಿಯರೆನ್ಸ್, ಹಿಸ್ಟೋಪೆಥಾಲಜಿಕಲ್ ಅಪಿಯರೆನ್ಸ್ ಆಫ್ ದ ಟ್ಯೂಮರ್. ಸೊ ಆಲ್ ದೀಸ್ things will help in diagnosing as well as these are important for treatment of bone tumors. Then how do you diagnose these bone tumors? So like lung malignancy, here also we ask for X-ray, CT scan, PET, and we can confirm with the biopsy. So ಎಲ್ಲಿ ಟ್ಯೂಮರ್ ಇದೆ ಆ ಪೋರ್ಷನ್ ಇಂದ ಸ್ಮಾಲ್ ಟಿಶ್ಯೂನ್ ತಗೊಂಡು ಅದನ್ನ ಸ್ಟಡಿ ಮಾಡಿಬಿಟ್ಟು ಏನು ಅಂತ ಹೇಳ್ತೀವಿ. ಓಕೆ, ಸೊ ಅದು ಬಯಾಪ್ಸಿ ಅಂತ ಹೇಳೋದು. So this is a X-ray. If you appreciate, you can, I think you, all of you can appreciate, this is a lesion. So this is one more lesion. So PET scan. So PET scan ಮಾಡಿದಾಗ exact location and if there is any distant metastasis, so ಬೇರೆ ಎಲ್ಲಾದ್ರೂ ಇದೆಯಾ ಅಂತ ನೋಡೋದಕ್ಕೆ PET scan help ಮಾಡುತ್ತೆ. So CT scan. So these are the various aspects of diagnosing. And this is a bone tumor. You can see a very large tumor involving the bony cavity with the destruction of the cortex. This is one more picture where you can see the involvement of the medullary cavity as well as it is extending up to the with the destruction of the bone. It is going beyond the bone to the adjacent soft tissue. So all these features will help you to diagnose the malignancy, whether it's a benign tumor or malignant tumor. So it's a high-grade tumor. So coming to management, so how for management again, so various factors are important. So what is the age, sex, whether it's a single tumor or multiple tumor, or what is the location of the tumor, which bone is involved, all these points matter. Then how do you treat? So like any other malignancy, we treat with chemotherapy, radiation, surgical management, and target therapy. So chemotherapy andre where we use anti-cancer, andre medicine which kills the tumor cells. And radiation, high energy rays will be used to kill the cancer cells. Surgically, so involved bone with will be with the surrounding tissue will be removed. So that is about the bone tumors. Now I'm going to brain cancer or brain tumors. So all of you know the brain histology, all of you must be knowing. So we have various parts in frontal bone, parietal bone, like that. So various regions of brain are there, which are also location for development of various types of bone tumors. So tumor andre, so this normal portion, so adರಲ್ಲಿ abnormal growth ಆಗ್ಬಿಟ್ಟು ಮಾಸ್ ತರ ಫಾರ್ಮ್ ಆಗುತ್ತೆ, ಅದನ್ನ ನಾವು ಟ್ಯೂಮರ್ ಅಂತ ಹೇಳ್ತೀವಿ. ಸೊ ಇನ್ಸಿಡೆನ್ಸ್ ಆಲ್ಮೋಸ್ಟ್ ಅಕೌಂಟ್ಸ್ ಟು 5 to 15%. ಅಂಡ್ ಲೈಕ್ ಬೋನ್ ಟ್ಯೂಮರ್ಸ್ ಇದರಲ್ಲೂ ಕೂಡ, ಸೊ ವಾಟ್ ಈಸ್ ದ ಲೊಕೇಶನ್ ಇಸ್ ಇಂಪಾರ್ಟೆಂಟ್, ವಾಟ್ ಈಸ್ ದ ಆರಿಜಿನ್ ಅಂದ್ರೆ ಯಾವ ಸೆಲ್ ಇಂದ ಟ್ಯೂಮರ್ ಅರೈಸ್ ಆಗ್ತಿದೆ ಇಸ್ ಇಂಪಾರ್ಟೆಂಟ್. ಮತ್ತೆ ಇನ್ನೊಂದು ಆಸ್ಪೆಕ್ಟ್ ಅಂದ್ರೆ ವೆದರ್ ಇಟ್ ಈಸ್ ಅ ಟ್ಯೂಮರ್ ಇನ್ವಾಲ್ವಿಂಗ್ ದ ಪ್ರೈಮರಿ, ಅಂದ್ರೆ ಬ್ರೈನ್ ಇಂದ ಅರೈಸ್ ಆಗ್ತಿದೆಯಾ ಅಥವಾ ಈಸ್ ಇಟ್ ಮೆಟಾಸ್ಟಾಟಿಕ್ ಅಂದ್ರೆ ಬೇರೆ ಆರ್ಗನ್ ಇಂದ ಟ್ಯೂಮರ್ ಬಂದು ಬ್ರೈನ್ ಅಲ್ಲಿ ಮೆಟಾಸ್ಟಸೈಸ್ ಆಗಿದೆಯಾ ಅನ್ನೋದು ಇಂಪಾರ್ಟೆಂಟ್ ಫಾರ್ ಟ್ರೀಟ್ಮೆಂಟ್ ಆಸ್ಪೆಕ್ಟ್. ಮತ್ತೆ ಇನ್ನೊಂದು ಏನಂತಂದ್ರೆ ಗ್ರೇಡ್ ಅಂತಂದ್ರೆ ಕ್ಯೂರಬಲ್, ಬಿನೈನ್ ಅಂತಂದ್ರೆ ಲೋ ಗ್ರೇಡ್, ಮ್ಯಾಲಿಗ್ನೆಂಟ್ ಅಂದ್ರೆ ಹೈ ಗ್ರೇಡ್ ಟ್ಯೂಮರ್. ಸೊ ದೀಸ್ ಫ್ಯಾಕ್ಟರ್ಸ್, ದೀಸ್ ಪಾಯಿಂಟ್ಸ್ ವಿಲ್ ಹೆಲ್ಪ್ ಇನ್ prognosis as well as survival of the brain patient cancer. But what are the risk factors? Okay, so the risk factors, it can be just a simple infection with Epstein-Barr virus, or it can be just a repeated exposure to electromagnetic fields, athwa just a radiation exposure can be a triggering factor for development of brain tumors. But the symptoms, what are the common symptoms with which this brain cancer can present? Okay, so it can be a simple headache, okay, athwa it can be complicated presentation, like patient may come with history of confusion, loss of recall, nausea, vomiting, dizziness. So it depends upon what is the site of origin of the malignancy, or just a change in the personal, like a behavioral change of a mood swing. So it has a varied presentation. Then how do you diagnose? So again, like lung cancer, by physical examination of the individual. So when you suspect a malignancy, we have to ask them to undergo various investigations like MRI, CT scan, or lumbar puncture. And one sun injection, lumbar spinal cord ಹಾಕ್ಬಿಟ್ಟು sample ತಗೊಂಡು ಅದನ್ನ ಟೆಸ್ಟ್ ಮಾಡೋದನ್ನ lumbar puncture ಅಥವಾ fluid ತಗೊಂಡು CSF analysis ಮಾಡ್ತೀವಿ. So ಅದು ಬಿಟ್ಟರೆ again biopsy. We take some material from the brain and the tissue will be studied for presence of malignancy. So ಇದು ಒಂದು CT scan. So you can see the tumor. So this is a normal brain. You can see a gray white lesion here. This is the tumor component. So like that. So this is a normal brain. So if you compare with the normal brain, here a well-defined lesion is there. So this is a tumor within a brain, what we call it as a meningioma. So adhe tara illi. Okay. So CT MRI most important investigation when you are dealing with brain or any other malignancy. So itu gross. Now specimen same patient when surgery they will do surgery athwa specimen bandaga. So ee tara irutte malignancy. So this is a normal bone brain tissue you are seeing. So within the normal brain tissue, so this is a tumor component. Okay. So it can be small, like micrometer, small millimeter in the idu. So it can be as big as 5 to 6 centimeters. Okay. So idu ಇನ್ನೊಂದು picture, gross picture. So this is a normal brain tissue. Idu tumor component. So again, the treatment, the surgery, andre the involved tissue tegiyodu, and radiation. Then sometimes the precise medicine irutte adannu kodabodu, athwa with chemotherapy, anti-cancer drugs ಕೊಟ್ಬಿಟ್ಟು treat ಮಾಡಬಹುದು. Okay. So what is important in all this malignancy? So prevention of cancer is better than cure. So we have to limit the exposure to risk factors, and early diagnosis has better prognosis and survival. So when you have any mild, even if it is a mild symptom, it has to be investigated. We have to know exact cause and rule out the underlying pathology. Thank you. So now I'll call upon the next speaker, Dr. Hemalata, professor. She will continue the talk. So she will be talking on breast cancers.
Good morning, everyone. I'm Dr. Hemalata A. I'm professor of pathology from Sri Devaraja Medical College. So, ಇವತ್ತು ನಾನು ಬ್ರೆಸ್ಟ್ ಕ್ಯಾನ್ಸರ್ ಬಗ್ಗೆ ಸ್ವಲ್ಪ ಮಾಹಿತಿಯನ್ನು ನಿಮ್ಗೆ ಕೊಡ್ತಿದ್ದೀನಿ. ಇದನ್ನ ಸ್ತನ ಕ್ಯಾನ್ಸರ್ ಅಂತಾನು ಕರೀತಾರೆ. ಈಗ ನೀವು ನಿಮ್ಮ ಮನೆ ಹತ್ರ ಆಗಲಿ, ನಿಮ್ಮ ರಿಲೇಟಿವ್ಸ್ ಆಗಲಿ, ನಿಮ್ಮ ನೀವು ನೋಡಿರ್ಬೋದು ಯಾರೋ ಒಬ್ರು ಬ್ರೆಸ್ಟ್ ಕ್ಯಾನ್ಸರ್ ಬಂದು ಸತ್ತು ಹೋದ್ರು ಅಂತ ಕೇಳಿರ್ಬೋದು. ಸೊ ಯೂಶಲಿ ನಾವೇನ್ ಅನ್ಕೋತೀವಿ, ಬ್ರೆಸ್ಟ್ ಕ್ಯಾನ್ಸರ್ ಅಂದ್ರೆ ಹೆಂಗಸರಿಗೆ ಮಾತ್ರ ಬರುತ್ತೆ ಅನ್ಕೋತೀವಿ. ಹಾಗೇನಿಲ್ಲ, 99.5% ಹೆಂಗಸರಲ್ಲಿ ಬಂದರೂ ಕೂಡ ಗಂಡಸರಲ್ಲಿ ಕೂಡ ಇದು ಬರ್ಬೋದು. ಸೊ next 15 minutes we'll just briefly go through what is the incidence of breast cancer India ನಲ್ಲಿ ಹೇಗಿದೆ, ಆಮೇಲೆ ಏನು ಡಯಾಗ್ನೋಸ್ ಮಾಡೋಕ್ಕೆ ಏನೇನು ರಿಸ್ಕ್ ಫ್ಯಾಕ್ಟರ್ಸ್ ಏನು, ಹೇಗೆ ನಾವು ಪ್ರಿವೆಂಟ್ ಮಾಡ್ಕೋಬಹುದು ಇದನ್ನ. ಈ ಮಾಹಿತಿ ಎಲ್ಲ ನಿಮ್ಮೊಬ್ಬರಿಗೆ ಅಲ್ಲ, ನೀವು ನಿಮ್ಮ ಮನೆ ಹತ್ರ ಆಗಲಿ, ನಿಮ್ಮ ರಿಲೇಟಿವ್ಸ್ ಆಗಲಿ, ನಿಮ್ಮ ಮನೇಲಿರೋ ಅಜ್ಜಿ ಇರು ಅಥವಾ ಯಾರಿಗಾದ್ರೂ ನೀವು ಯು ಕ್ಯಾನ್ ಎಜುಕೇಟ್ ದೆಮ್ ಅಬೌಟ್ ಆಲ್ ದೀಸ್ ಥಿಂಗ್ಸ್. ನಾವೇನ್ ಮೊದಲೆಲ್ಲ ಏನಿರ್ತಿತ್ತು ಅಂದ್ರೆ ಬ್ರೆಸ್ಟ್ ಕ್ಯಾನ್ಸರ್ ಅಂದ್ರೆ ಜಾಸ್ತಿ ಇಟ್ ವಾಸ್ ಮೋರ್ ಇನ್ ವೆಸ್ಟರ್ನ್ ಕಂಟ್ರೀಸ್, ಅಂದ್ರೆ ಫಾರಿನ್ ಕಂಟ್ರೀಸ್ ಅಲ್ಲಿ ತುಂಬಾ ಇರ್ತಿತ್ತು, ಎಸ್ಪೆಷಲಿ US, ಇಂಗ್ಲೆಂಡು ಅಂತ ಕಡೆ ಜಾಸ್ತಿ ಇರ್ತಿತ್ತು. ಬಟ್ ಈಗ ಇವನ್ ಇನ್ ಇಂಡಿಯಾ ದ ಇನ್ಸಿಡೆನ್ಸ್ ಆಫ್ ಬ್ರೆಸ್ಟ್ ಕ್ಯಾನ್ಸರ್ ಇಸ್ ಇನ್ಕ್ರೀಸಿಂಗ್. ಸೊ ಇಟ್ ಇಸ್ ದ ನಂಬರ್ 1 ಕ್ಯಾನ್ಸರ್ ಅಮಾಂಗ್ ಇಂಡಿಯನ್ ಫಿಮೇಲ್ಸ್. ಮೊದಲು ಸರ್ವೈಕಲ್ ಕ್ಯಾನ್ಸರ್ ಅಂತ ಈಗಾಗಲೇ ಮೇಡಮ್ ನಿಮ್ಗೆ ಅದ್ರ ಬಗ್ಗೆ ಹೇಳಿದ್ರು, ದಟ್ ವಾಸ್ ದ ಮೋಸ್ಟ್ ಕಾಮನ್ ಕ್ಯಾನ್ಸರ್. But even breast cancer that has replaced cervical cancer as number 1 cancer among the Indian females. So idra incidence bandu 1 laksha women alli at 25 to 26 depends on the places. Iga urban places like Bangalore, Delhi atara urban places alli ಜಾಸ್ತಿ ಇರುತ್ತೆ, ರೂರಲ್ ಪ್ಲೇಸಸ್ ಅಲ್ಲಿ ಕಮ್ಮಿ ಇರುತ್ತೆ. ಬಟ್ ಅಗೈನ್ ಈಗ ಮತ್ತೆ ನೋಡ್ತಾ ಇದ್ದಾರೆ ಎಲ್ಲ, ಅದು ಆಲ್ಮೋಸ್ಟ್ ಈಕ್ವಲೈಸ್ ಆಗ್ತಾ ಇದೆ. ಅಂಡ್ ಮಾರ್ಟಾಲಿಟಿ ಅಂದ್ರೆ ಈ ಬ್ರೆಸ್ಟ್ ಕ್ಯಾನ್ಸರ್ ಇಂದ ಸಾಯೋರು ಕೂಡ ಆಲ್ಮೋಸ್ಟ್ ಎವ್ರಿ 1 ಲಕ್ಷ ಜನಕ್ಕೆ 12 ರಿಂದ 13 ಜನ ಬ್ರೆಸ್ಟ್ ಕ್ಯಾನ್ಸರ್ ಇಂದ ಸಾಯ್ತಾ ಇದ್ದಾರೆ. ಸೊ ತುಂಬಾ ಇಂಪಾರ್ಟೆಂಟ್ ಬಿಕಾಸ್ ಆಫ್ ಇನ್ಕ್ರೀಸ್ ಇನ್ ದ ಇನ್ಸಿಡೆನ್ಸ್ ಆಫ್ ದಿಸ್ ಪರ್ಟಿಕ್ಯುಲರ್ ಕ್ಯಾನ್ಸರ್. ಏನಾಗುತ್ತೆ ಅಂದ್ರೆ ತುಂಬಾ ಜನ ದೇ ವಿಲ್ ನಾಟ್ ಗೋ ಅಂಡ್ ಶೋ ದ ಡಾಕ್ಟರ್. ವಿ ಹ್ಯಾವ್ ಸೀನ್ ಸೋ ಮೆನಿ ಕೇಸಸ್. ಮನೆಯಲ್ಲಿ ಯಾರಿಗೂ ಹೇಳೇ ಇರಲ್ಲ ಅವ್ರಿಗೆ ಈ ತರ ಎದೆನಲ್ಲಿ ಗಡ್ಡೆ ಆಗಿದೆ ಅಥವಾ ತುಂಬಾ ನೋವಿದೆ ಅಥವಾ ಅಲ್ಸರ್ ಆಗಿದೆ, ಯಾರಿಗೂ ಮನೆಯಲ್ಲಿ ನಾಚಿಕೆ ಪಟ್ಕೊಂಡು ಹೇಳೋದೇ ಇಲ್ಲ. ಸೊ ಯು being like school children, you should know that it is very, very important that you spread awareness about this particular cancer. ಸೊ ನಾ ಹೇಳ್ದಂಗೆ ಇನ್ಅಡಿಕ್ವೇಟ್ ಬ್ರೆಸ್ಟ್ ಕ್ಯಾನ್ಸರ್ ಸ್ಕ್ರೀನಿಂಗ್ ಎಷ್ಟೊಂದು ಜನ ಹೇಳ್ಕೊಡಲ್ಲ, ಅಥವಾ ಮನೆಗೆ ಹೋಗಿ ಎಲ್ಲ ಆರಾಮಾಗಿದ್ದೀರಾ ಅಂತ ಡಾಕ್ಟರ್ಸ್ ಕೇಳಿದಾಗ ಎಲ್ಲ ಚೆನ್ನಾಗಿದೆ ಅಂತ ಅವರು ಹೇಳ್ಬಿಡ್ತಾರೆ. ಸೊ ಅಡ್ವಾನ್ಸ್ ಆದಾಗ ನಾವು ಡಯಾಗ್ನೋಸ್ ಮಾಡ್ತೀವಿ. ಆಮೇಲೆ ಕೆಲವೊಂದು ಕಡೆ ಎಲ್ಲಾನು ಟ್ರೀಟ್ಮೆಂಟ್ ಸರಿಯಾಗಿ ಇರೋದಿಲ್ಲ ಫೆಸಿಲಿಟೀಸು. ಇದಕ್ಕೆಲ್ಲ ದೊಡ್ಡ ಟ್ರೀಟ್ಮೆಂಟ್ ಈಗಾಗಲೇ ಹೇಳಿದ್ದಾರೆ, ರೇಡಿಯೋಥೆರಪಿ ಬೇಕು, ಕೀಮೋಥೆರಪಿ ಎಲ್ಲ ಬೇಕು. ಫೆಸಿಲಿಟೀಸ್ ಸ್ಮಾಲ್ ಪ್ಲೇಸಸ್ ಅಲ್ಲಿ ಇರೋರಿಗೆ ಆ ಫೆಸಿಲಿಟೀಸು ಮೇ ನಾಟ್ ಬಿ ಅವೈಲಬಲ್. ಸೊ ಈ ಗ್ರಾಫ್ ಅಲ್ಲಿ ಲೈಕ್ ಯು ಕ್ಯಾನ್ ಸಿ ದಟ್ initially age they used to think breast cancer is more in older people. So ಇದು ನೋಡಿದ್ರೆ ಲೈಕ್ 50 to 60 ಪ್ಲಸ್ ಅಲ್ಲಿ ಜಾಸ್ತಿ ಇದೆ. ಬಟ್ ಪ್ರೆಸೆಂಟ್ ಅಲ್ಲಿ ರೆಡ್ ಕಲರ್ ಎಲ್ಲ ಈಗಿರೋ ಇನ್ಸಿಡೆನ್ಸ್. ಸೊ ಯು ಕ್ಯಾನ್ ಸಿ ದಟ್ ಬ್ರೆಸ್ಟ್ ಕ್ಯಾನ್ಸರ್ ಇಸ್ ಇನ್ಕ್ರೀಸಿಂಗ್ ಈವನ್ ಅಮಾಂಗ್ ದ ಯಂಗರ್ ಇಂಡಿವಿಜುವಲ್. ಇಲ್ಲಿ ನೋಡಿ 30 to 40, ಈವನ್ 20 to 30 ಇಯರ್ಸ್ ಅಲ್ಲಿ ಕೂಡ ಈ ಬ್ರೆಸ್ಟ್ ಕ್ಯಾನ್ಸರ್ ಕಾಣಿಸ್ಕೊತಾ ಇದೆ. ಸೊ ಇಟ್ ಇಸ್ ವೆರಿ, ವೆರಿ ಇಂಪಾರ್ಟೆಂಟ್ ಟು ಬಿ ಅವೇರ್ ಆಫ್ ಬ್ರೆಸ್ಟ್ ಕ್ಯಾನ್ಸರ್. ಸೊ ರಿಸ್ಕ್ ಫ್ಯಾಕ್ಟರ್ಸ್ ಏನು ಬ್ರೆಸ್ಟ್ ಕ್ಯಾನ್ಸರ್ಗೆ? ಒಂದು ಫ್ಯಾಮಿಲಿ ಹಿಸ್ಟ್ರಿ, ಮನೆಯಲ್ಲಿ ಯಾವ ತರ ಆದ್ರೂ ಕ್ಯಾನ್ಸರ್ ಆಗಿದ್ರೆ, ಎಸ್ಪೆಷಲಿ ಅಗೇನ್ ಬ್ರೆಸ್ಟ್ ಕ್ಯಾನ್ಸರ್ ಆಗಿರ್ಬೋದು ಅಥವಾ ಓವೇರಿಯನ್ ಕ್ಯಾನ್ಸರ್ ಆಗಿರ್ಬೋದು, ಸರ್ವೈಕಲ್ ಕ್ಯಾನ್ಸರ್ ಆಗಿರ್ಬೋದು, ಫ್ಯಾಮಿಲಿ ಹಿಸ್ಟ್ರಿ ಇಸ್ ವೆರಿ ಇಂಪಾರ್ಟೆಂಟ್. ಅಂಡ್ ಸಮ್ ಆಫ್ ದೆಮ್ ವಿಲ್ ಹ್ಯಾವ್ ಸಮ್ ಕೈಂಡ್ ಆಫ್ ಜೀನ್ ಮ್ಯೂಟೇಷನ್. ಈಗ ನೀವು ಆಂಜಲಿನಾ ಜೋಲಿ ಅಂತ ಒಂದು ಇಂಗ್ಲಿಷ್ ಮೂವಿ ಆಕ್ಟ್ರೆಸ್, ಯು ಮಸ್ಟ್ ಹ್ಯಾವ್ ಹರ್ಡ್ ಆಫ್ ಹರ್. ಸೊ she got her genetics study done and she was supposed to have BRCA1 ಅಂತ ಜೀನ್ ಹೆಸರು BRCA1 ಅಂತ ಮ್ಯೂಟೇಷನ್ ಇತ್ತು. ಸೊ ಶಿ ಅಂಡರ್ವೆಂಟ್ ಟ್ರೀಟ್ಮೆಂಟ್ ಫಾರ್ ದ ಸೊ ದಟ್ ಶಿ ವಿಲ್ ನಾಟ್ ಡೆವಲಪ್ ಬ್ರೆಸ್ಟ್ ಕಾರ್ಸಿನೋಮಾ ಲೇಟರ್. ಆಮೇಲೆ ಲೇಟ್ ಚೈಲ್ಡ್ ಬೇರಿಂಗ್. ಸೊ ದಟ್ ಈಸ್ ನೌ-ಎ-ಡೇಸ್ ಎಸ್ಪೆಷಲಿ ಅರ್ಬನ್ ಕಂಟ್ರೀಸ್ ಯು ಆರ್ ಸೀಯಿಂಗ್ many females are having children very late. So that is also one of the reason. Early menstruation, late menopause, obesity, ಆಮೇಲೆ ಇನ್ಕ್ರೀಸ್ ಬ್ರೆಸ್ಟ್ ಡೆನ್ಸಿಟಿ, OCPs ತಗೋತಾರೆ ಕೆಲವೊಬ್ರೆಲ್ಲಾನು. ಸೊ ದಟ್ ಮೇ ಆಲ್ಸೋ ಬಿ ಒನ್ ಆಫ್ ದ ರಿಸ್ಕ್ ಫ್ಯಾಕ್ಟರ್. ಕೆಲವೊಬ್ರು ಮಿನೋಪಾಸ್ ಆದ್ಮೇಲೆ ಅಂದ್ರೆ ಮುಟ್ಟು ನಿಂತ ಮೇಲೆ ದೇ ವಿಲ್ ಅಂಡರ್ಗೋ ಸಮ್ ಕೈಂಡ್ ಆಫ್ ಈಸ್ಟ್ರೋಜನ್ ರೀಪ್ಲೇಸ್ಮೆಂಟ್ ಥೆರಪಿ ಬಿಕಾಸ್ ಆಫ್ ಸಮ್ ಸಿಂಪ್ಟಮ್ಸ್. ಸೊ ಅಂಥವ್ರಿಗೂ ಚಾನ್ಸಸ್ ಆರ್ ಮೋರ್. ಅಂಡ್ obviously excessive alcohol intake and tobacco intake, these both are risk factors for all kind of cancers. But what we should remember is in India, increase in the urbanization and westernization, especially nam diet ಏನು ಪಿಜ್ಜಾ ಜಾಸ್ತಿ ತಿನ್ನೋದು, ಬರ್ಗರ್, ದೇ ಹ್ಯಾವ್ ಬರ್ಗರ್ ಜಾಸ್ತಿ ತಿನ್ನೋದು, they have more of different content than the Indian food, especially the vegetable content ಕಮ್ಮಿ ಇರುತ್ತೆ, and the oil content, different kind of oils, so content ಎಲ್ಲ ಜಾಸ್ತಿ ಇರುತ್ತೆ. The kind of cooking is different in these food, so that may be one of the cause. So as I told you earlier, associated with changing lifestyle and food habits. So they are walking ಎಲ್ಲ ಕಮ್ಮಿ ಮಾಡ್ತಾರೆ. ಮೊದಲ ತರ ಹೋಗಿ ಇವನ್ ಫೀಮೇಲ್ಸ್ ಮೊದಲೆಲ್ಲ ಹೋಗಿ ಎಲ್ಲ ಕೆಲಸ ಮಾಡ್ತಿದ್ರು ಫೀಲ್ಡ್ಸ್ ಅಲ್ಲೆಲ್ಲ. ಸೊ ಫಿಸಿಕಲ್ ಆಕ್ಟಿವಿಟಿ ಕಮ್ಮಿ ಆಗ್ತಾ ಇದೆ, ಜಾಸ್ತಿ ಕೂತ್ಕೊಂಡು ಕೆಲಸ ಮಾಡೋದು ಜಾಸ್ತಿ ಆಗ್ತಾ ಇದೆ. ಸೊ ಆಲ್ ದೋಸ್ ಥಿಂಗ್ಸ್ ಆರ್ ಮೇ ಬಿ ರಿಸ್ಕ್ ಫ್ಯಾಕ್ಟರ್ಸ್ ಫಾರ್ ಇನ್ಕ್ರೀಸ್ ಇನ್ ಬ್ರೆಸ್ಟ್ ಕಾರ್ಸಿನೋಮಾ. ಸೊ ಈಗ ಹೇಗೆ ಪ್ರೆಸೆಂಟ್ ಮಾಡ್ಬೋದು ಅಂದ್ರೆ ನಿಮಗೆ ಹೌ ಕ್ಯಾನ್ ಯು ಥಿಂಕ್ ಓಕೆ ದೇ ಶುಡ್ ಗೋ ಫಾರ್ ಅಂಡ್ ಮೀಟ್ ದ ಡಾಕ್ಟರ್? ಒಂದು ಪೇನ್ ಇಂದ ಬ್ರೆಸ್ಟ್ ಇರ್ಬೋದು, ಅಥವಾ ಆರ್ಮ್ ಪಿಟ್ ಅಂದ್ರೆ ಕಂಕ್ಳು ಅಂತ ಏನು ಹೇಳ್ತೀವಿ ಅಲ್ಲಿ ಪೇನ್ ಇರ್ಬೋದು. ಸ್ಕಿನ್ ಕವರಿಂಗ್ ದ ಬ್ರೆಸ್ಟ್, ಇಟ್ ಮೇ ಹ್ಯಾವ್ ಸಮ್ ಚೇಂಜ್ ಇನ್ ದ ಟೆಕ್ಸ್ಚರ್, ಅಂದ್ರೆ ಪಕ್ಕರಿಂಗ್ ಅಥವಾ ಡಿಂಪ್ಲಿಂಗ್ ತರ ಆಗಿರುತ್ತೆ ಅದಿರ್ಬೋದು. ಅಥವಾ ದೇರ್ ಕ್ಯಾನ್ ಬಿ ಚೇಂಜ್ ಇನ್ ದ ಶೇಪ್ ಆರ್ ಸೈಜ್ ಆಫ್ ದ ಬ್ರೆಸ್ಟ್, ಅಥವಾ ಸಮ್ ಕೈಂಡ್ ಆಫ್ ಬ್ಲಡ್ ಆರ್ ಸಮ್ ಕೈಂಡ್ ಆಫ್ ಲಿಕ್ವಿಡ್ ಮೇ ಊಸ್ ಔಟ್ ಆಫ್ ದ ನಿಪ್ಪಲ್, ಅದು ಇರ್ಬೋದು. ಆಮೇಲೆ ನಿಪ್ಪಲ್ ಚೇಂಜಸ್ ಇನ್ವರ್ಟೆಡ್ ಆಗ್ಬೋದು, ಅಥವಾ ಪೊಸಿಷನ್ ಚೇಂಜ್ ಆಗ್ಬೋದು. ಇಲ್ಲ ಅಂದ್ರೆ ಕೆಲವೊಬ್ರು ದೇ ಕಮ್ ವಿತ್ ಲಂಪ್ ಇನ್ ದ ಬ್ರೆಸ್ಟ್, ಅಂದ್ರೆ ನನಗೆ ಗಡ್ಡೆ ಸಿಕ್ಕಿದೆ, ನಾನು ಸ್ನಾನ ಮಾಡ್ಬೇಕಿದ್ರೆ ನನಗೆ ಐ ಕುಡ್ ಫೀಲ್ ದಟ್ ಸಮ್ ಕೈಂಡ್ ಆಫ್ ಸ್ವೆಲ್ಲಿಂಗ್ ಇಸ್ ದೇರ್ ಇನ್ ಮೈ ಬ್ರೆಸ್ಟ್, ಸೊ ಅದೂ ಇರ್ಬೋದು. ಅಥವಾ ರ್ಯಾಶ್ ಇರ್ಬೋದು, ರೆಡ್ನೆಸ್ ಇರ್ಬೋದು, ಅಥವಾ ಬರೀ ಕಂಕ್ಳ ಕೆಳಗೇನೆ ಲಿಂಫ್ ನೋಟ್ಸ್ ಅಂತ ಏನ್ ಹೇಳ್ತೀವಿ ಅದು ದೊಡ್ಡದಾಗಿ ದೇ ಮೇ ಕಮ್ ಟು ಯು. ನೀನು ಹೇಳ್ಬೋದು ನಿಮ್ಮ ಮನೆಯಲ್ಲಿ ಯಾರಾದ್ರೂ, ಅಥವಾ ಯಾರಾದ್ರೂ ಹೇಳ್ಬೋದು ಈ ತರ ಆರ್ಮ್ ಪಿಟ್ ಅಲ್ಲಿ ನನಗೆ ಒಂದು ಗಡ್ಡೆ ಸಿಗ್ತಾ ಇದೆ ಅಂತ. ಸೊ ಆಲ್ ದೀಸ್ ಆರ್ ಸಮ್ ಆಫ್ ದ ಸಿಂಪ್ಟಮ್ಸ್ ಆಫ್ presenting symptoms of breast cancer. So immediately such patients should be taken for to surgeon for further follow-up or further diagnosis. So ಈ ಮಧ್ಯ ಒಂದು ribbon ಇದೆ. So I think all of you can see. Can someone message or type in the chat box what is the significance of that particular ribbon? ಸೊ ಹೇಗಿರ್ಬೋದು, ದೀಸ್ ಆರ್ ಸಮ್ ಆಫ್ ದ ಇಮೇಜಸ್ ಫ್ರಮ್ ದ ವೇರಿಯಸ್ ಪೇಷಂಟ್. ಸೊ ಇಲ್ಲಿ ನೋಡ್ಬೋದು ನೀವು, ದ ನಿಪ್ಪಲ್ ಇಸ್ ರಿಟ್ರಾಕ್ಟೆಡ್, ಅಥವಾ ಇಲ್ಲಿ ನೀವು ನೋಡ್ಬೋದು ರೆಡ್ ಆಗಿದೆ ಏರಿಯಾ, ಸ್ವೆಲ್ಲಿಂಗ್ ಇದೆ, ಅಲ್ಲಿ ಊತ ಇದೆ ಅಂತ ನಮಗೆ ಅನ್ಸುತ್ತೆ. ಸೊ ದಟ್ ಇಸ್ ಆಲ್ಸೋ ಒನ್ ಆಫ್ ದ ಪ್ರೆಸೆಂಟಿಂಗ್ ಫೀಚರ್, ಕ್ಲಿನಿಕಲ್ ಫೀಚರ್. ತುಂಬಾ ಜನ ಅದೇ ಹೇಳ್ದಂಗೆ ನಾನು ಮುಚ್ಚಿಟ್ಕೊಂಡಿರ್ತಾರೆ, ಹೇಳೋದೇ ಇಲ್ಲ. ಸೊ ಅಂತ ಟೈಮಲ್ಲಿ ಏನಾಗುತ್ತೆ, ಸೊ ಈ ತರ ದೆರ್ ವಿಲ್ ಬಿ ಎಕ್ಸ್ಟೆನ್ಸಿವ್ ಅಲ್ಸರೇಷನ್, ದೊಡ್ಡ ನೋಡ್ಯೂಲ್ ಒಂದು ಗಡ್ಡೆ ತರ ಆಗಿ ಅದು ಅಲ್ಸರ್ ಆಗಿ ಇಟ್ ಕ್ಯಾನ್ ಪ್ರೆಸೆಂಟ್ ಲೈಕ್ ದಿಸ್ ಆಲ್ಸೋ. ಏನೇನ್ ಟೆಸ್ಟ್ ಮಾಡ್ಬೋದು? ಸೊ ಈ ತರ ಯಾರೋ ಒಬ್ರು ನಿಮ್ಗೆ ಹೇಳ್ತಾರೆ, ಸೊ ನೀವು ಡಾಕ್ಟರ್ ಹತ್ರ ಕರ್ಕೊಂಡು ಹೋಗ್ತೀರಾ, ಸರ್ಜನ್ ಹತ್ರ ಕರ್ಕೊಂಡು ಹೋಗ್ತೀರಾ. ಸೊ ಏನೇನ್ ಟೆಸ್ಟ್ ಮಾಡ್ಬೋದು? ಈಗಾಗಲೇ ಮೇಡಮ್ ನಿಮ್ಗೆ ಸೂಜಿ ಪರೀಕ್ಷೆ ಬಗ್ಗೆ ಹೇಳಿದ್ದಾರೆ. ಸೊ ಯು ಕ್ಯಾನ್ ಸಿ ಹಿಯರ್, ನೀಡಲ್ ಹಾಕ್ಬಿಟ್ಟು ಅದರಿಂದ ಸ್ವಲ್ಪ ರಕ್ತ ತಗೊಂಡು ಅದನ್ನ ಮೈಕ್ರೋಸ್ಕೋಪ್ ಕೆಳಗೆ ನೋಡಿ ವಿ ವಿಲ್ ಟೆಲ್ ವೆದರ್ ಇಟ್ ಇಸ್ ಮ್ಯಾಲಿಗ್ನೆನ್ಸಿ ಆರ್ ನೋ. ಸೊ ದಟ್ ಇಸ್ ಯೂಶಲಿ ಡನ್ ಬೈ ಅ ಪೆಥಾಲಜಿಸ್ಟ್. ಆಮೇಲೆ ಏನಾಗುತ್ತೆ, ಕನ್ಫರ್ಮ್ ಆದ್ಮೇಲೆ ಎಕ್ಸಿಷನ್ ಮಾಡ್ತಾರೆ. ಈಗ ನಿಮ್ಗೆ ಸರ್ ಹೇಳ್ತಾ ಇದ್ರು ಕ್ಯಾನ್ಸರ್ ಅಂದ್ರೆ ಕ್ರ್ಯಾಪ್ ತರ ಅಂತ. ಸೊ ಇಲ್ಲಿ ನೋಡ್ಬೋದು ನೀವು, ಇದು ಎಲ್ಲೋ ಇರೋದೆಲ್ಲ ನಾರ್ಮಲ್ ಬ್ರೆಸ್ಟ್. ಈ ಮಧ್ಯದಲ್ಲಿ ಯು ಕ್ಯಾನ್ ಸಿ ದಟ್ ದರ್ ಇಸ್ ಅ ಇರೆಗ್ಯುಲರ್ ಗ್ರೇ ವೈಟ್ ಮಾಸ್ ವಿತ್ ಇನ್ಫಿಲ್ಟ್ರೇಷನ್ ಮಾರ್ಜಿನ್ಸ್. ಈ ಕ್ರ್ಯಾಬ್ ಕಾಲ್ ಹೆಂಗಿರುತ್ತೆ ಹಂಗೆ ಇಟ್ ಇಸ್ ಆಲ್ ಎಕ್ಸ್ಟೆಂಡಿಂಗ್ ಇಟ್ಸ್ ಕ್ಲಾಸ್ ಇನ್ ಟು ದ ಸರೌಂಡಿಂಗ್ ನಾರ್ಮಲ್ ಬ್ರೆಸ್ಟ್ ಪ್ಯಾರಂಕೈಮಾ. ಸೊ ದಿಸ್ ಇಸ್ ಹೌ ಅ ಕ್ಯಾನ್ಸರ್ ವಿಲ್ ಲುಕ್. ಸೊ ನಾವು ಇದರಲ್ಲಿ ಮತ್ತೆ ಸೆಕ್ಷನ್ಸ್ ಎಲ್ಲ ಕೊಟ್ಟು ಅದನ್ನ ಮೈಕ್ರೋಸ್ಕೋಪ್ ಕೆಳಗೆ ನೋಡ್ತೀವಿ. ನೋಡಿದಾಗ ನಮ್ಗೆ ಹಿಂಗೆ ಕಾಣಿಸುತ್ತೆ. ಸೊ ಟ್ಯೂಮರ್ ಸೆಲ್ಸ್ ಎಲ್ಲ ಇರುತ್ತೆ. ಈ ಬ್ಲೂ ಏನಿದೆ ಅದೆಲ್ಲ ನ್ಯೂಕ್ಲಿಯಸ್, ಅದ್ರ ಸುತ್ತ ಸ್ವಲ್ಪ ಏನು ಲೈಟ್ ಪಿಂಕ್ ಇದೆಲ್ಲ ಅದೆಲ್ಲ ಸೈಟೋಪ್ಲಾಸಮ್. ನಾರ್ಮಲ್ ಬ್ರೆಸ್ಟ್ ಟಿಶ್ಯೂ ಹಿಂಗೆ ಕಾಣಿಸೋದಿಲ್ಲ, ಸೊ ಅದು ಬೇರೆ ತರ ಕಾಣಿಸುತ್ತೆ. ಸೊ ದಿಸ್ ಇಸ್ ಹೌ ಮ್ಯಾಲಿಗ್ನೆಂಟ್ ಸೆಲ್ಸ್ ವಿಲ್ ಲುಕ್. ಸುತ್ತ ಇರೋದೆಲ್ಲ ಸ್ಟ್ರೋಮಾ ಅಂತ ಹೇಳ್ತೀವಿ. ಸೊ ಇದೆಲ್ಲ ನೋಡಿ ನಾವು ಗ್ರೇಡ್ ಮಾಡ್ತೀವಿ. ಗ್ರೇಡ್ 1 ಇದೆಯಾ, ಗ್ರೇಡ್ 2 ಇದೆಯಾ, ಗ್ರೇಡ್ 3 ಇದೆಯಾ ಅಂತ ಮೈಕ್ರೋಸ್ಕೋಪ್ ಒಳಗೆ ನೋಡ್ಕೊಂಡು ನಾವು ಗ್ರೇಡಿಂಗ್ ಮಾಡ್ತೀವಿ. ಸೊ ಯಾಕದು ಇಂಪಾರ್ಟೆಂಟ್ ಅಂತ ಆಮೇಲೆ ಹೇಳ್ತೀನಿ ನಿಮ್ಗೆ. ಸೊ ಡಿಪೆಂಡಿಂಗ್ ಆನ್ ದ ಸೈಜ್ ಆಫ್ ದ ಟ್ಯೂಮರ್ ಅಂಡ್ ಗ್ರೇಡ್ ಆಫ್ ದ ಟ್ಯೂಮರ್, ಆಮೇಲೆ ಅದು ಎಲ್ಲೆಲ್ಲಿ ಮೆಟಾಸ್ಟಸೈಸ್ ಆಗಿದೆ. ಈಗ ಏನಂದ್ರೆ ಈ ಕ್ಯಾನ್ಸರ್ ಬರೀ ಬ್ರೆಸ್ಟ್ ಅಲ್ಲೇ ಇರಲ್ಲ, ಹಂಗೆ ಬಿಟ್ಬಿಟ್ರೆ ಇಟ್ ವಿಲ್ ಸ್ಟಾರ್ಟ್ ಸ್ಪ್ರೆಡ್ಡಿಂಗ್. ಈಗ ಒಂದು ಆಪಲ್ ಕೊಳ್ತು ಹೋಗ್ಬಿಟ್ರೆ ಒಂದೇ ಕಡೆ ಇರಲ್ಲ ಅಲ್ವಾ, ಅದು ಫುಲ್ ಸ್ಪ್ರೆಡ್ ಆಗ್ತಾ ಹೋಗುತ್ತೆ. ಅದ್ರ ಪಕ್ಕ ಆಪಲ್ ಇದ್ರೆ ಅದಕ್ಕೂ ಸ್ಪ್ರೆಡ್ ಆಗುತ್ತೆ. ಹಾಗೇನೆ ಇಟ್ ವಿಲ್ ನಾಟ್ ಸ್ಟೇ ಇನ್ ಒನ್ ಪ್ಲೇಸ್. ಸೊ ಲಂಗ್ಸಿಗೆ ಹೋಗ್ಬೋದು, ಬ್ರೈನಿಗೆ ಹೋಗ್ಬೋದು, ಅಲ್ಲೆಲ್ಲ ಸ್ಪ್ರೆಡ್ ಆಗ್ಬೋದು. ಸೊ ಡಿಪೆಂಡಿಂಗ್ ಆನ್ ಹೌ ಫಾರ್ ಇಟ್ ಹ್ಯಾಸ್ ಸ್ಪ್ರೆಡ್ ವಿ ವಿಲ್ ಸ್ಟೇಜ್ ದ ಡಿಸೀಸ್ 0, 1, 2, 3, 4 ಅಂತ ಸ್ಟೇಜ್ ಮಾಡ್ತೀವಿ. ಸೊ ಒಂದು ಗ್ರೇಡ್ ಮಾಡ್ತೀವಿ ಮೈಕ್ರೋಸ್ಕೋಪ್ ಕೆಳಗೆ ನೋಡಿ, ಇನ್ನೊಂದು ಸ್ಟೇಜ್ ಮಾಡ್ತೀವಿ. ಸೊ ಇದೆಲ್ಲ ಏನಕ್ಕೆ ಇಂಪಾರ್ಟೆಂಟ್ ಅಂದ್ರೆ ಟ್ರೀಟ್ಮೆಂಟ್ಗೆ ತುಂಬಾ ಇಂಪಾರ್ಟೆಂಟ್ ಅದೆಲ್ಲ. ಸೊ ಇದು ಇಷ್ಟೊತ್ತು ನಾನು ನಿಮ್ಗೆ ಏನೇನು ಹೇಳಿದೆ ಅದ್ರ ಬಗ್ಗೆ ಎಲ್ಲ ಈ ಪಿಕ್ಚರ್ ಅಲ್ಲಿ ಒಂದು ಹೈಲೈಟ್ ಮಾಡಿದ್ದೀನಿ. ಸೊ ಏನೇನು ರಿಸ್ಕ್ ಫ್ಯಾಕ್ಟರ್ಸು, ಸಿಂಪ್ಟಮ್ಸ್ ಏನೇನಾಗ್ಬೋದು, ಆಮೇಲೆ ಐ ವಾಸ್ ಟೆಲಿಂಗ್ ಯು ಅಬೌಟ್ ಸ್ಟೇಜಿಂಗ್. ಸೊ ಬರೀ ಬ್ರೆಸ್ಟಲ್ಲೇ ಇದೆಯಾ, ಅಥವಾ ಲಿಂಫ್ ನೋಡ್ಸ್ಗೆ ಹೋಗಿದ್ಯಾ, ಕಂಕಲ್ ಕೆಳಗೆಲ್ಲ ಹೋಗಿದ್ಯಾ, ಸ್ಪ್ರೆಡ್ ಆಗಿದೆಯಾ, ಅಥವಾ ಅದು ಲಂಗ್ಸಿಗೆ ಹೋಗಿದ್ಯಾ, ಅಥವಾ ಬೋನಿಗೆ ಹೋಗಿದ್ಯಾ. ಕೆಲವೊಬ್ಬರಿಗೆ ಬ್ರೈನ್ ಮೆಟಸ್ಟಸಿಸ್ ಆಗಿ ಬರ್ತಾರೆ ಕೆಲವೊಬ್ರು. ಸೊ ಹೀಗೆ ಅದ್ರ ಪ್ರಕಾರ ಸ್ಟೇಜು ಮಾಡ್ತೀವಿ. ಸೊ ಇನ್ನೊಂದು ಟೆಸ್ಟ್ ಏನ್ ಮಾಡ್ತಾರೆ ಅಂದ್ರೆ ಹಾರ್ಮೋನ್ ಸ್ಟಡೀಸ್ ಅಂತ. ಸೊ ಈಸ್ಟ್ರೋಜನ್ ಅಂತ ಕೇಳಿರ್ಬೋದು ನೀವು, ಪ್ರೊಜೆಸ್ಟ್ರಾನ್ ಅಂತ ಕೇಳಿರ್ಬೋದು. ಸೊ ಆ ಬ್ರೆಸ್ಟ್ ಟಿಶ್ಯೂನಲ್ಲಿ, ಆ ಮ್ಯಾಲಿಗ್ನೆನ್ಸಿನಲ್ಲಿ ಎಷ್ಟು ಹಾರ್ಮೋನ್ಸ್ ಇದೆ, ER ಎಷ್ಟಿದೆ, PR ಎಷ್ಟಿದೆ ಅಂತ ಒಂದು ಸ್ಪೆಷಲ್ ಟೆಸ್ಟ್ ಮಾಡ್ತೀವಿ. ಇಟ್ ಇಸ್ ಕಾಲ್ಡ್ ಆಸ್ ಇಮ್ಯುನೋಹಿಸ್ಟೋಕೆಮಿಸ್ಟ್ರಿ. ಅದ್ರ ಜೊತೆಗೆ ಹರ್ಟನ್ಯೂ ಅಂತ ಇನ್ನೊಂದು ಟೆಸ್ಟ್. ಸೊ ಇದೆಲ್ಲ ಮಾಡಿ ವಿ ವಿಲ್ ಟ್ರೀಟ್ಮೆಂಟ್ ಏನ್ ಕೊಡಬೇಕು ಅಂತ ಡಿಸೈಡ್ ಮಾಡ್ತದೆ. ಸೊ ಆಲ್ ದೀಸ್ ಥಿಂಗ್ಸ್, ಡಯಾಗ್ನೋಸ್ಟಿಕ್ ಮೊಡಾಲಿಟೀಸ್ ಆರ್ ಇಂಪಾರ್ಟೆಂಟ್ ಫಾರ್ ಟ್ರೀಟಿಂಗ್ ದ ಪೇಷಂಟ್. ಸೊ ಹೇಳಿದೆ ನಾನು ಗ್ರೇಡು ಅಥವಾ ಹಿಸ್ಟೋಪೆಥಾಲಜಿ ಹೇಳಿದೆ, ಆಮೇಲೆ ಮೆಟಾಸ್ಟಸಿಸ್ ಸ್ಟೇಜಿಂಗ್ ಹೇಳಿದೆ, ಆಮೇಲೆ ಟ್ರೀಟ್ಮೆಂಟ್ ಬಗ್ಗೆ, ಆಮೇಲೆ ನಾನು ನಿಮಗೆ ಹಾರ್ಮೋನ್ ರಿಸೆಪ್ಟರ್ಸ್ ಬಗ್ಗೆ ಹೇಳಿದೆ. ಸೊ ಅದ್ರ ಮೇಲೆ ದೇ ವಿಲ್ ಡಿಸೈಡ್ ಸರ್ಜರಿ ಮಾತ್ರ ಸಾಕಾ, ಅಥವಾ ರೇಡಿಯೇಷನ್ ಕರೆಂಟ್ ಅಂತ ಏನ್ ಹೇಳ್ತಾರೆ ಅದು ಕೊಡ್ಬೇಕಾ, ಅಥವಾ ER PR ಎಲ್ಲ ಪಾಸಿಟಿವ್ ಇದ್ರೆ ಟೆಮೋಕ್ಸಿಫಿನ್ ಅಂತ ಒಂದು ಹಾರ್ಮೋನ್ ಕೊಡ್ತಾರೆ. ಸೊ ಹಾರ್ಮೋನ್ ಥೆರಪಿ ಕೊಡ್ಬೇಕಾ, ಕೀಮೋಥೆರಪಿ ಕೊಡ್ಬೇಕಾ. ಈಗ ಹೊಸದಾಗಿ ಟಾರ್ಗೆಟೆಡ್ ಥೆರಪಿ ಅಂತ ಇದೆ, ಬರೀ ಸೆಲ್ಸ್ ಮಾತ್ರ ಟಾರ್ಗೆಟ್ ಮಾಡೋ ತರ. ಸೊ ಯಾವ್ದು ಕೊಡ್ಬೇಕು ಅಂತ ಆಂಕಾಲಜಿಸ್ಟ್ ಅಂತ ಹೇಳ್ತೀವಿ. ಸೊ ದೇ ವಿಲ್ ಡಿಸೈಡ್ ದಟ್ what kind of treatment should be given to the patient. So October is breast cancer awareness month, so all of you should know about it. ಅದೊಂದು ನೆನ್ಪಿಟ್ಕೋಬೇಕು. ಸೊ ಏನಂದ್ರೆ ಈ ಅವೇರ್ನೆಸ್ ಮಂತ್ ಬಗ್ಗೆ ಎವ್ರಿ ವುಮನ್ ಶುಡ್ ಹ್ಯಾವ್ ಆಕ್ಸೆಸ್ ಟು ಎಜುಕೇಶನ್. They should know about breast cancer. They should be able to undergo screening for breast cancer, treatment to support. ಆಮೇಲೆ they need a lot of mental support also. So ಇದೆಲ್ಲನೂ ಅವರಿಗೆ ಸಿಕ್ಕಬೇಕು. So that is that entire thing. Usually October ಅಲ್ಲಿ there will be lot of seminars and awareness programs, and October is the breast cancer awareness month. ಸೊ ನಾನು ಅವಾಗಿಂದ ಸ್ಕ್ರೀನಿಂಗ್ ಬಗ್ಗೆ ಹೇಳಿದೆ. ಸೊ ಹೆಂಗೆ ನಾವು ಕ್ಯಾನ್ಸರ್ ರಿಸ್ಕ್ ಎಲ್ಲ ಡಿಕ್ರೀಸ್ ಮಾಡ್ಕೊಳ್ಳೋದು. ಸೊ ದೀಸ್ ಆರ್ ಸಮ್ ಆಫ್ ದ ಥಿಂಗ್. ಅರ್ಲಿ ಪ್ರೆಗ್ನೆನ್ಸಿ ಬಿಫೋರ್ 25 years of age, 1 or 2 pregnancy. Breast feeding is very very important. So progesterone ಅಂತ ಹಾರ್ಮೋನ್ ಇನ್ಕ್ರೀಸ್ ಆಗುತ್ತೆ ಬ್ರೆಸ್ಟ್ ಫೀಡ್ ಮಾಡಿದಾಗ. ಸೊ ದಟ್ ವಿಲ್ ಹ್ಯಾವ್ ಸಪ್ರೆಷನ್ ಆಫ್ ದ ಕ್ಯಾನ್ಸರ್ ಸೆಲ್ಸ್. 1-2 ಕ್ಯಾನ್ಸರ್ ಸೆಲ್ಸ್ ಇದ್ರೂ ಅದೆಲ್ಲ ಸತ್ ಹೋಗುತ್ತೆ. ಸೊ ಬಿಕಾಸ್ ಆಫ್ ದಿಸ್ ಪ್ರೊಜೆಸ್ಟ್ರಾನ್ ಹಾರ್ಮೋನ್. ಆಮೇಲೆ ಸೆಲ್ಫ್ ಎಕ್ಸಾಮಿನೇಷನ್ ಆಫ್ ಬ್ರೆಸ್ಟ್ ಇಸ್ ಇಂಪಾರ್ಟೆಂಟ್. ನಾನು ಆದ್ರೆ ಒಂದು ವಿಡಿಯೋ ಇದೆ ಅದ್ರ ಬಗ್ಗೆ ತೋರಿಸ್ತೀನಿ ನಿಮಗೆ. ಆಮೇಲೆ ಮಿನೋಪಾಸ್, ಸುಮ್ಮನೆ ಹಾರ್ಮೋನ್ ಟ್ರೀಟ್ಮೆಂಟ್ ತಗೊಂಡು ಮಿನೋಪಾಸ್ನ ಎಕ್ಸ್ಟೆಂಡ್ ಮಾಡ್ಕೋಬಾರ್ದು. ಹಾರ್ಮೋನ್ ಟ್ರೀಟ್ಮೆಂಟ್ ಶುಡ್ ಬಿ ಟೇಕನ್ ಓನ್ಲಿ ಇಫ್ ಅಬ್ಸಲ್ಯೂಟ್ಲಿ ಇಂಡಿಕೇಟೆಡ್. ಹೆಲ್ದಿ ಫುಡ್, ವೆಯ್ಟು, ರೆಗ್ಯುಲರ್ ವಾಕಿಂಗು, ಎಕ್ಸಸೈಸ್ ಮಾಡಿಕೊಂಡು ವೆಯ್ಟ್ ನಾನು ಕರೆಕ್ಟಾಗಿ ಇಟ್ಕೋಬೇಕು. ಸೊ ಆಲ್ ದೀಸ್ ಆರ್ ಸಮ್ ಆಫ್ ದ ಫ್ಯಾಕ್ಟರ್ಸ್ ದಟ್ ವಿಲ್ ಡಿಕ್ರೀಸ್ ದ ರಿಸ್ಕ್. ಸೊ ಸ್ಕ್ರೀನಿಂಗ್ ಅಂತ ಹೇಳ್ತಾ ಇದ್ದೆ. ನಮ್ಮ ಇಂಡಿಯಾನಲ್ಲಿ ಸ್ಕ್ರೀನಿಂಗ್ ಪ್ರೋಗ್ರಾಮ್ಸ್ ಆರ್ ನಾಟ್ ಫಿಕ್ಸ್ಡ್, ಬಟ್ ಅಬ್ರಾಡ್ ದೆರ್ ಆರ್ ಸ್ಟ್ಯಾಂಡರ್ಡ್ ಸ್ಕ್ರೀನಿಂಗ್ ಪ್ರೋಗ್ರಾಮ್ಸ್. ಸೊ ಯಾವಾಗ ಸ್ಕ್ರೀನಿಂಗ್ ಮಾಡ್ಕೋಬೇಕು ಬ್ರೆಸ್ಟ್ ಕ್ಯಾನ್ಸರ್ಗೆ ಅಂತ ಆಲ್ರೆಡಿ ಇಟ್ ಇಸ್ ಬೀನ್ ಫಿಕ್ಸ್ಡ್. ಲೈಕ್ ಏಜ್ 40 ಆಗಿದ ತಕ್ಷಣ patient should be told that you can undergo screening program. ಆಮೇಲೆ ಮ್ಯಾಮೋಗ್ರಾಮ್ಸ್ ಎಲ್ಲಾನು ಇಯರ್ಲಿ 45 years ಅಷ್ಟೊತ್ತಿಗೆ ಶುರು ಮಾಡ್ಕೋಬಹುದು. ಸೊ ಡಿಪೆಂಡಿಂಗ್ ಆನ್ ದ ಮ್ಯಾಮೋಗ್ರಾಮ್ ಅಟ್ ಫಸ್ಟ್ 45 ಅಲ್ಲಿ ಮಾಡಿಸ್ಕೊಂಡಾಗ ಅದ್ರ ಮೇಲೆ they can decide whether every year or every other year they have to undergo. ಫ್ಯಾಮಿಲಿ ಹಿಸ್ಟ್ರಿ ಏನಾದ್ರು ಇದ್ರೆ ಹೇಗೆ. ಸೊ ಆಲ್ ದೋಸ್ ಥಿಂಗ್ಸ್ ಕ್ಯಾನ್ ಬಿ ಡಿಸೈಡೆಡ್. ಸೊ ಮ್ಯಾಮೋಗ್ರಾಮ್ ಅಂದ್ರೆ ಹೀಗೆ, ಇಟ್ಸ್ ನಥಿಂಗ್ ಬಟ್ ಎಕ್ಸ್ರೇ ಆಫ್ ದ ಬ್ರೆಸ್ಟ್. ಸೊ ಅದರಲ್ಲಿ ಗೊತ್ತಾಗುತ್ತೆ ಕ್ಯಾನ್ಸರ್ ಏನಾದ್ರು ಶುರು ಆಗಿದ್ರೆ ಈ ಡೆನ್ಸಿಟೀಸ್ ಮೇಲೆ ದೇ ವಿಲ್ ಡಿಸೈಡ್. ಸೊ ಇನ್ನೊಂದು ಏನಂದ್ರೆ ನಾವು ಮನೆಯಲ್ಲಿ ಸೆಲ್ಫ್ ಬ್ರೆಸ್ಟ್ ಎಕ್ಸಾಮಿನೇಷನ್ ಯು ಕ್ಯಾನ್ ಟೀಚ್ ಆಲ್ ಯುವರ್ ಅಜ್ಜಿ ಇರ್ಬೋದು ಅಥವಾ ಅಮ್ಮ ಇರ್ಬೋದು, ಅವರಿಗೆಲ್ಲ ಹೇಳ್ಬೋದು ಹೇಗೆ ಒಂದು ಮಿರರ್ ಅಲ್ಲಿ ನೋಡ್ಕೊಂಡು ದೇ ಕ್ಯಾನ್ ಸಿ ದ ಚೇಂಜ್ ಇನ್ ದ ಬ್ರೆಸ್ಟ್, ಆರ್ ಮಲ್ಕೊಂಡಾಗ ದೇ ಕ್ಯಾನ್ ಫೀಲ್ ದ ಬ್ರೆಸ್ಟ್ ಅಂಡ್ ಸಿ ಇಫ್ ದರ್ ಇಸ್ ಎನಿ ನೋಡ್ಯೂಲ್ ಆರ್ ಎನಿ ಚೇಂಜ್. ನಾನು ಹೇಳ್ದೆ ನಿಮ್ಗೆ ಹೇಗೆ ಏನೇನು ಚೇಂಜಸ್ ಆಗ್ಬೋದು ಅಂತ, ಅದೆಲ್ಲ ನೋಡ್ಕೋಬಹುದು. ಅಥವಾ ನಿಂತ್ಕೊಂಡಾಗ ಸ್ನಾನ ಮಾಡಿದಾಗ ಅವಾಗ್ಲೂ ಎಕ್ಸಾಮಿನೇಷನ್ ಮಾಡ್ಕೋಬಹುದು. ಸೊ ಇದೊಂದು ವಿಡಿಯೋ ಇದೆ, ಒಂದು 3 minutes ವಿಡಿಯೋ ಇದೆ.
Oh, sure not ready? Please prepare.
Back to
Hello everyone, I am Auntie Sue, and I'm joined by all my old pals today. We're going to share a few more about breast cancer, the most common cancer among women. Can strike that one. One in women in Singapore will develop breast cancer by 75 years old. So whatever age you are, you should do self-check of your breast. Come, let me show.
So there is some problem in this video. So you can go to YouTube and you can check for self-examination of breasts. So istond video sigutte nimge. So you can just see how to go about self-examination of breast. So this is my last slide. So thank you for your patient hearing. So you should remember, we have to all fight for breast cancer together. So ನಾನು ನಿಮಗೆ ಒಂದು ಕ್ವೆಶನ್ ಕೇಳಿದ್ದೆ, ಈ ಪಿಂಕ್ ರಿಬ್ಬನ್ ಅಂದ್ರೆ ಏನು ಅಂತ. ಸೊ ಆಲ್ ದ ರಿಬ್ಬನ್ಸ್, ಯಾರಾದರೂ ಎನಿವನ್, what is this pink ribbon? So all the ribbons, they tell about cancer. So pink is about breast cancer. So pink ribbon ಎಲ್ಲಾದರೂ ನೀವು ನೋಡಿದಾಗ, so it talks about it tells us about breast cancer. So ಅದನ್ನ ನೆನ್ಪಿಟ್ಕೊಳ್ಳಿ. So pink ribbon stands for breast cancer. So thank you. ಈಗ Dr. Shilpa, she will give vote of thanks and concluding remarks about this International Pathology Day.
Good afternoon. So it was a wonderful program, and we come to an end of this program. So I deem it a great privilege to propose a vote of thanks on this occasion, that is International Pathology Day. We from the Department of Pathology are extremely thankful to the management for supporting us to conduct this wonderful program. I thank all the resource person from the Department of Pathology for giving an excellent talk on different types of cancers and their awareness and also risk factors. I also extend my sincere thanks to all the delegates who attended this program and made this online program very successful. Hope you guys enjoyed this program and have understood different types of risk factor and regarding all types of cancers and also their prevention. So you can spread the same message to your family and friends. Thank you and have a great day. And one more thing, this feedback form will be sent in the form of Google form, which will be in the form of a link. Kindly fill that form and submit so that it will be useful for us. Thank you. Have a great day.